And welcome to the October 19th, 2020 virtual legislative meeting of the Anne Arundel County Council. We are now in session. Madam Secretary, please call the roll.
Ms. Hare?
Present.
Ms. Lacey?
Present.
Mr. Volkey?
Present.
Mr. Pruski?
Here.
Ms. Fiedler?
Present.
Ms. Radvian?
Present.
Ms. Pickard?
Present.
Madam Auditor, Ms. Smith?
Present.
Madam Legislative Counsel, Ms. Schuett?
Present.
Madam Chair, all are present.
Thank you so much. Please pause for the invocation at this time. Ms. Hare will lead.
Let us be thankful for this day that we have been given, for its blessings, its opportunities, and its challenges. May we appreciate and use each day that comes to us to the best of our abilities through collaboration and kindness. Let us seek strength and guidance for each day's duties and problems and be challenged to give our best always together.
Thank you. Ms. Fiedler will now lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We will now hear the Open Meetings Act statement.
The county attorney has asked that I read the following statement. The Maryland Open Meetings Act, a state law, requires public meetings to be open to the public and to be held in places reasonably accessible to individuals who would like to attend these meetings. In addition, provisions of the county charter and the rules of the county council require meetings to be open to the public and held at the county seat, meaning Annapolis. The virtual format of this meeting of the County Council is due to the COVID-19 emergency and is necessary in light of the serious health risks associated with public gatherings, as well as the governor's various executive orders limiting public gatherings. While a virtual meeting of this type was not envisioned by the Open Meetings Act, steps have been taken to ensure that this virtual meeting includes alternate accessibility features that the Open Meetings Act Compliance Board and the courts have reviewed and approved, such as having a call-in phone number that allows anyone with a telephone to call and listen to the meeting, broadcasting the meeting with video and audio on cable TV and on the web, allowing written public comments to legislation be filed with the clerk and considered by the council, and allowing the public to call in or appear via Zoom and testify live. The County Office of Law has opined that the public access provided by this technology makes this virtual meeting reasonably accessible to the public as required by the OMA. The Office of Law has also reviewed whether, with these technological features in place, it is still necessary to suspend Council Rules 3105 and 3106 that require public participation and reasonable seating for the public and the media. The conclusion is that it is not necessary to suspend these rules for the same reason that they have concluded that the measures implemented by the council for virtual meetings satisfy the reasonable accessibility requirement under the OMA. The virtual format of the meetings allows public participation and media access as required by the rules, and also allows unlimited participation that is not subject to seat capacity limits in the chambers or in the building. For these reasons, they have concluded that the requirements of Rules 3105 and 3106 are being satisfied, and therefore it is not necessary to waive these rules. Council has also asked whether it is necessary to suspend Rules 102 and 103, which require the meeting to be held in the county seat. In 2013, at the request of the council, the Office of Law opined that a council member who is appearing at a meeting via a live video monitor would satisfy the venue requirement through the virtual presence. It is noted that the administrative officer to the council controls the hearing and is present in the Arundel Center during meetings, and the virtual meeting is hosted by the assistant administrative officer from a location in Annapolis. Those factors support the Office of Law's conclusion that the meetings are being held at the county seat and therefore it is not necessary to suspend Rules 3102 and 3103.
Thank you, Madam Secretary. Madam Secretary, please read the ethics statement.
The Ethics Commission has asked that I advise you that under certain circumstances, members of the public may qualify as lobbyists when they testify before the County Council. If so, the law requires that certain information be filed with the Ethics Commission. The chairman of the Ethics Commission has asked that those who wish to testify in any form review the general information on lobbying sheet located on the ethics website under forms and publications. If there are any questions about lobbying requirements, please contact the Ethics Commission at 410-222-4413.
Thank you. We will now open our invitation to audience. Madam Secretary, do we have any comments or communications on any subject not included in the printed agenda received from the members of the public?
Madam Chair, we did receive 4 submissions for invitation to audience. However, they were in regards to specific legislation that was on the agenda. As such, they were transferred to the written comments of each specific piece of legislation.
Thank you. We will now hear from members of the public who signed up ahead of time. We have 3 people signed up to speak on matters not listed on our agenda tonight. When it is your turn, please unmute yourself and begin by stating your name and address for the record. Remarks will be limited to 2 minutes. The first speaker on my list is Miss Amy Tanner. Miss Tanner, are you with us this evening? Miss Tanner, are you with us this evening? I am not seeing any movement. I'm going to go down to number 2. Miss Frances Burton, are you with us this evening? Miss Frances Burton, are you with us this evening?
Madam Chair, I do not see her on the list of attendees.
Okay, we'll move forward to, we have our third speaker for this section is Mr. Adam Wyndham. Mr. Wyndham, are you with us this evening?
I am, however, I did not intend to sign up for 2 sections. I'll save my comments for Bill 8320, please.
Okay, thank you. Perfect. Okay. Were we able to ascertain if Ms. Amy Tanner has signed in?
I do not see her on the list of attendees.
Okay, thank you.
Madam. No.
Okay, thank you so much. The invitation to audience is now closed. Is there any item any council member would like to place on the agenda? Ms. Lacey?
Thank you, Madam Chair. Sarah Lacey, District 1. Madam Secretary, I would like to be added as a co-sponsor to Bill 8120. Thank you.
Thank you, and so noted. Ms. Lacey is a co-sponsor to 8120?
That's correct.
Thank you. At this time, the council will now sit as the Board of Health. We will welcome Dr. Nilesh Kalyanaraman and his staff. Dr. Kalyanaraman will be presenting to us, and then there will be time for questions. Dr. K, good evening. You have the floor, sir.
Good evening. Thank you, Madam Chair, and thank you, County Council. I will, give me 1 second, and I will flip over to my presentation. I'm assuming you can see my share screen. Great, thank you. Thank you for having me here today. I just want to take a moment to note our leadership here who have joined me here today: Tony Gedden, Sean Kane, Billy Penley, Sandy O'Neill, Becky Asher, Don Curdian, Karen Siska Creel, Tom McCarty, Ellen Jones, and Crystal Coldire. In the best of times, I'm just tremendously proud of the work they and the rest of the health department do, our staff, but obviously during COVID, it has been that and then some. And my hats off to everybody at the health department and our leadership for the work they've done, and really just going above and beyond every single day. I also want to thank our partner agencies, Adrian Michler at the Mental Health Agency and Pam Brown at the Anne Arundel County Partnership for Children, Youth, and Families, who are intimately involved in our work that we do. As an overview, this month is the 90th anniversary of the health department. From our small beginnings, we are now an organization of $6 million organization with over 800 employees. Last year, that was 700. COVID has changed our size and scope, and is reflected in the fact that we've had to add another site in order to be able to provide all the services that we do in the community. Our vision is for a vibrant Anne Arundel County with healthy people and healthy communities, and our mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. And that is something that we take to heart and comes up not just in our daily work, but also in the work we do with others in the community. And we're going to talk a little bit more about that. So I'm going to start with new initiatives, and then I'm going to talk about the core work that we do, and lastly, touch on COVID. We've had multiple opportunities to talk about that, so I did want to take the time to focus on our core activities over the course of the year. One of our major initiatives is our Healthy Anne Arundel Coalition. It's a countywide collaborative led by the Department of Health that involves community organizations, faith-based institutions, economic development, federally qualified health centers, hospitals, and county and city government agencies to identify and address the priority health needs of the county. And the real goal is to align the resources of our member organizations to achieve a common purpose. And that purpose is to address the health needs identified by the community. We relaunched it after a 3-year hiatus. Excuse me. Our first meeting of our guiding coalition was February 6th, and we were due to have our community meeting on March 27th. As with everything, it was delayed. And so we're really happy to have our community kickoff meeting on October 1st, just 3 weeks ago, with over 150 participants to set priorities. Our guiding coalition just met today a few hours ago to settle on our mission, vision, our priorities, our strategies, and our priorities, so that we can really make progress on these issues of what is most important to the community. And so we'll be sharing more about that in the coming weeks and months, and a core part of that will be engaging the community into that work. The next item I want to highlight is our work around health equity and racial justice. And health equity really just means that everybody has a fair and just opportunity to be as healthy as possible. Our data show that there are racial and ethnic disparities persistent in our health measures in the county, and that's true across the state and the country. And so in November 2019, we declared racism a public health issue. The county executive did that, and to actually work on this issue, we are standing up the Office of Health Equity and Racial Justice, and that is, we are actively hiring for the lead for that office right now. But COVID kind of made it a glaring priority, and pretty quickly in the course of COVID, within weeks, we started to see disparities, particularly along racial and ethnic lines, and also amongst people who are lower income. We started to see that they were getting COVID at higher rates and also suffering higher consequences from that. And so I think that gets into one of the guiding principles, which is to collect, analyze, and to report disaggregated data. A lot of the times we want to look at the top line data, and that's really important. But not everybody's average. Averages blend together a lot of different groups and numbers, and we want to understand what's making that, what makes up that average. And then we want to include those who are most affected in decisions, and benchmark our progress. And so that means that we're going to include the community in understanding what the priorities are, and then identifying what the solutions to that are. And we need to, and part of that is investing in our public health, healthcare, and social infrastructure to be able to address these issues before they become full-blown concerns. And so, to that point of disaggregated data, this is the data that we're seeing, and this is the reason that we are focusing on this. And this is in COVID, right? COVID, which just showed up in our county about 7 months ago. And pretty quickly, you see those disparities. You see that amongst Blacks, there's about 1.5 times higher likelihood of death from COVID. A little bit less than that in terms of getting COVID. Amongst Hispanics, about 3 times higher likely to get it, but the death rate is similar to the demographics. And so you get into these situations where we really have to dig into the data to understand what's happening, and it's not necessarily predictable. It's really a matter of understanding the data and then following it to where it needs to go. And so from that, as I noted, we looked at that data, and then we targeted educational material through those distribution channels, targeting the African American and Hispanic community because of their disproportionate rates of disease. Prioritized walk-up testing in those communities that were affected, and also made sure that case management was a key part of our contact tracing. And by that, I mean providing supports such as housing, income, food, transportation during isolation and quarantine from COVID, so that people could successfully stay isolated or stay quarantined during that time and prevent the transmission. And this is just an example of the type of work that will come out of this office as we get it up and running and look at other health conditions. Another priority initiative is gun violence as a public health issue. The county executive declared gun violence a public health issue and committed to decreasing gun violence in the county. We had our gun violence prevention task force, which met throughout 2019, produced a preliminary report, in December, and then a final report in May that was released in May. And from that came our gun violence intervention team, which is formed and led by the Department of Health, but includes a range of agencies to evaluate and implement the recommendations that were in that. And really the goal is to take those recommendations and evaluate them for feasibility, impact, and cost. So there were a lot of recommendations put forth by the Gun Violence Prevention Task Force. Some of them were more doable than others. Some of them, such as policy changes, can't be done at the county level because of preemption. So some policy changes are the domain of the state or the domain of the federal government. So that impacts feasibility. Impact is really important. Are these changes going to produce a result, or is that uncertain? And then lastly, what's the cost? Is it a low cost item? Can we move forward? Do we need to identify funding for it, or is it prohibitively expensive? These are the kind of determinations that we're making when we're doing this work. And this is the data that really underlies it. When we look at who this is affecting, the data is one of the key pieces that we're looking at as we're doing this work. I've talked about the fact that our goal is to get beyond the rhetoric of more guns, less guns, and talk about less violence, which everybody is in agreement on. And so that means understanding what the data says about the violence that is coming from gun violence. And so it's breaking it down by suicides and homicides, and digging even deeper and understanding who is affected. We see that, for instance, 80% of the suicides by firearm are in white males, but 57% of the homicides occur in Black males. It's understanding these kind of nuances, and we'll be digging further on geography and income, but it's understanding these kind of nuances that help us to tailor some of our approaches to get the biggest, to target the biggest areas of morbidity in our county. And the other key piece of this is organizing it on what we call the PSE framework. So when I say that we're addressing gun violence as a public health issue, it means that we're going to be using a public health framework to understand this. What are the policy changes that we need to look at? Changing guidelines or policy at organization or governmental levels. What are the systems? Excuse me. So looking at rules, procedures, processes within organizations. How can we better implement programs to address gun violence? And what's the environment? So, what are the factors in our environments? Physical factors, social factors, economic factors that play a role in this, that either make gun violence more likely or less likely. And then how do we get less of the bad factors and more of the good factors? That's how we're organizing this work so that we can have a more structured and public health oriented approach to this work. Suicide prevention is another item. We talked about this, I want to say January, at a county council meeting. It's certainly a key item that we are locked in on. As I mentioned, the gun violence intervention team will have a focus on suicide as it accounts for over 60% of the gun deaths. But there are other programs and initiatives that we are either in the process of, or which are already in process, or which are launching that are targeted at suicide prevention. One of those is the youth suicide report that we authored a couple of years ago that focuses on 4 areas and on which work continues. So looking at family life and safety in the home environment, special populations at risk, identifying community risk, and then the role of social media and cyberbullying. The mental health agency has a mental health initiative for older adults. And then of course there's a mental health task force that was jointly done by the AACPS and the mental health agency. And one of the things that will be coming out of that from the mental health agency is a look across the range of initiatives to try to decrease some of the duplication and bring a little bit more coherence to that, to make sure we're not working at cross purposes and really focus our energies on the suicide prevention piece. Now I'm going to transition to some of our core programs. And I'm going to highlight some of the areas where our work was either altered or even enhanced during the COVID time, as it of course affected our service delivery. One is our food pantry. We've certainly highlighted the work of the food pantry in Brooklyn Park. It opened in February 2019, and it provides fresh vegetables, fruit, meat, and dairy, which really makes it unique and also allows it to really focus on how we are providing not just fresh food, but also guidance and education on how to prepare that food and how to have a healthier diet. And this is the product of a partnership with a range of county agencies and nonprofits, and it's really been a wonderful program. We've of course had to adapt it to COVID, and we know that the need for food has been higher during COVID, and so we've seen that we've increased the number of households, 76% increase in the number of households, and a 93% increase in the number of residents over the past 5 months. And we've done that while using safe practices for COVID. And you see a couple of pictures here on how we're doing that, setting up stations. If you've had the opportunity to visit, there was a nice waiting room, cooking demonstrations, opportunity to engage with staff. Unfortunately, we haven't been able to do that, but we are still able to provide that food service and food pick by using a drive-through pickup process. Our REACH program is another program that's been affected during COVID. It provides access to low-cost primary, preventive, and specialty health care. In FY20, it coordinated care for over 1,200 enrolled members and 106 emergency cases. Primary care was about half of that, same for specialists, and then a few emergency room visits thrown in there. But during COVID-19, we had to change once again, and we had to institute contactless, seamless enrollment in this. And so over the months from April to September, we had over 950 encounters with medical providers. 47 new members were able to enroll. Because of the high demand for this, we actually included another position for this in our FY21 budget. And we're adding that new coordinator this month who's going to allow us to serve an additional 350 people. This is the kind of work that when we target, and as part of our Healthy Animal Coalition, when we hear that we need better access to care, this is just one example of a program that helps improve access to care amongst our community. Our medical assistance eligibility and administrative care coordination, or MA eligibility program, really critical during this time. We know that during this time, we've seen Medicaid enrollment increase during COVID because of changes in employment. So Medicaid has been a critical resource for people. From April to September 2020, 1,358 new MA applications were done and 620 renewals. And this was all done once again remotely, so that we can get people enrolled in Medicaid. One of the items that we've talked a lot about is behavioral health during COVID and the challenges of mental health and also substance use. And so we've had to change how we operate. Our adolescent and family services continue to provide services via telehealth and in person as needed. And they've done 28 new admissions over this time and continue to serve 296 families. Our Road to Recovery clinics in Glen Burnie and Annapolis continued on-site medication services and telehealth and on-site counseling. And once again, able to manage new admissions and continue to serve over 500 individuals. Critically, our peer support services have been able to continue virtual recovery support. And that was probably one of the harder transitions. One of the cores of our peer support is their ability to interact with people, establish a connection, and be able to guide them through the process. And so doing that virtually, not really what they were built for. And yet they seamlessly were able to do that and continue to provide that vital peer support service to serve over 850 individuals. And then during this time, we've been having meetings with our recovery community who've had to make a lot of changes and have struggled through these transitions of how to provide crisis beds and recovery housing while managing COVID. And we continue to provide that service by connecting individuals to this crisis beds, over 704 individuals to the crisis beds and over 320 individuals for recovery housing. Similarly, our Strengthening Families program, which provides training in parenting, children's social and life skills, and helps participants build a healthy and positive family relationship, has been able to graduate families via Zoom. 12 families and 29 individuals in North County, and then in Annapolis area, 5 families and 13 individuals. And so that's been a process, that's been a program that's been in process of how we can continue to provide those types of supports, particularly once again, when that interaction with the parents and the family is really critical to the assessment and being able to tailor our services. We're still able to provide those services virtually and by providing telephonic support. Along that line, our Wellmobile, which is a key part of providing on-demand medication-assisted treatment with buprenorphine, was operating in Glen Burnie. Once again, due to COVID, you can see our Wellmobile there in the picture. Not the ideal setting in which to have multiple people in a closed space. So we had to make an adaptation. And so now we're providing telehealth services for the entire county from Monday through Friday, and then services at our Langley Road Clinic in Glen Burnie and in Bestgate Road Clinic in Annapolis. Critically, we did get funding to expand the Wellmobile to Annapolis as soon as we can do that on the Wellmobile. Based on COVID and protections and all that kind of stuff, we are excited to be able to do that. But like everything else these days, that service is waiting for COVID to change. But a key part of our services is being able to link people to community provider. And we've been able to link about 72% of people successfully to community providers. And we are in the process of making working with community providers to expand their ability to provide medication-assisted treatment services And that includes having us serve um, as a hub to initiate treatment and then refer out to community providers to whom we provide supports so that they can manage the maintenance medication. Oops, sorry about that. In the interest of time, I'm going to move a little bit more quickly because I realize I'm going a little slower than I thought I was. Our harm reduction services are a critical part of what we do. They're peer delivered and judgment free harm reduction that really focus on quality of life and improving that quality of life for somebody with substance use disorder. While our goal is for somebody to be substance free, we recognize that there are steps along the way. And our goal is to identify what steps a person is willing to take, support them in that, and then at their pace move them along that pathway. It's not a program that's in lieu of substance use, stopping substance use. It just recognizes that it's a staircase, and we need to take the first step together. And so some of the programs we have are overdose prevention through naloxone, having fentanyl test strips so that people can test their drugs and understand if there's fentanyl in there. And then overdose education as well on what to do if somebody is overdosing. Part of that is safer drug use, understanding how to make sure that when you're using drugs, you're using it safely. And we find that that's probably one of the most important engagement tools that we have for people who are using drugs to understand that somebody cares enough about them to care about whether they're going to be able to survive and wake up in the morning. Is a powerful engagement tool, and it allows us to continue working with people who, once they form that interaction, are then more willing to take the next step after that. And that's really the power of harm reduction. It's a way of saying we care enough. So far, we've distributed 919 Narcan kits and over 1,000 fentanyl testing strips in Brooklyn Park and Annapolis. And we've also trained over 1,100 people in the overdose response program. Key part of that is our Overdose Survivors Outreach Services. We utilize peers in the hospital emergency departments, and we offer overdose survivors paths to treatment and wraparound services. And they really are able to provide that bridge from the hospital to the outpatient setting and to essentially walk them through and support them through those days after hospital ED discharge. Those are very challenging days. If you've been to the emergency room, you know that you'll get some instructions to follow through after that. And they might not always be easy to act on, particularly for somebody who is suffering from substance abuse. It can be challenging to navigate those days after the emergency room. So this peer support program is really critical in providing that connection. And so far, we've assisted 427 individuals at BWMC and 453 at Anne Arundel Medical Center. I want to highlight our Road to Recovery at Ordnance Road Correctional Center. This program provides methadone and Vivitrol to incarcerated inmates. And this is a really critical program because the overdose death risk is about 40 to 120 times higher on reentry without treatment. And the reason for that is that people who've been incarcerated generally are not using drugs while incarcerated. And when they're released, are often released into similar circumstances in which they came from. And then the risk of relapse is really high. Because they haven't been using, the risk of overdose is also very high because their body is not used to the drug anymore. And so using the same dose as you did before can be really life-threatening. And so this program, we provide medication-assisted treatment while incarcerated and then connect to community treatment upon release. And we're one of the few fully accredited medication-assisted treatment programs in the correctional setting in the United States. And we were recognized by the National Association of County Health Departments as a promising practice in July 2019. And so this is really a key part of our work here, and it's really a national model that we have underway here. I still want to focus on our crisis interventions teams. They focus on crisis stabilization and work to alleviate the need for an increased level of care. So their goal is really to decrease hospitalizations, incarceration, and homelessness by working with people in crisis to get them to the resources they need. It's very similar to very similar in principle to our Overdose Survivors program in that it takes people in crisis and navigates them to the resources they need. We can see during COVID that there's a great need for this. We saw a 22% increase during COVID months in our warm line, and we've also seen we also saw our mobile crisis teams had an increase in calls to school up until March. So this is school year 19 to 20. We also saw an increase in cases to school. So we're seeing that our crisis intervention team services are really valued by the community and are really sought out by the community. And they're both the right thing to do in that they work with people who are in crisis to get them the care that they need before waiting for them to become full blown and suffer even worse consequences. And it's also really a cost-effective way to do that as well, because it provides a lower level of care earlier in the course and doesn't require as high a level of care and higher cost if we didn't act earlier. Part of that is our jail diversion program. And that's a pretrial program that screens for mental health and substance use disorder and develops that plan in cooperation with criminal justice partners. And people who completed this program have a really low recidivism rate, 7% recidivism rate. And it's once again another one of those programs that when you intervene early, you have really positive results that are also cost effective. And that's that. We've talked about crisis and training, including mental health first aid and critical incident stress management. Those continue to be critical pieces of the work that our mental health agency is doing. We've also talked about our safe stations that are available 24/7, 365 days a year, where anybody can go to a police or fire station seeking substance use disorder treatment. And it's actually one of the items that came out of our opioid intervention team a few years ago. We have restarted our opioid intervention team work. We restarted that a few weeks ago. And it's going to be critical as we see the increased incidence of opioid overdoses and opioid deaths in our county. Sorry. Our Healthy Start home visiting program. Switching gears a little bit. Our Healthy Start home visiting program looks to provide wraparound services to pregnant women who are impacted by substance use, and by providing mental health, substance abuse screening, health information, referrals, education, and peer support. And in FY20, we were able to work with 172 women, and 99 of the 112 enrolled pregnant women resided in high-risk census tracts. And I think that's really a critical piece, is to recognize that there are high-risk areas, and we've talked a little bit about that in our Healthy and Arundel work, but that there are areas where there are higher risk, and that's part of looking at our health disparities. Focusing on our school health services, and we've talked about our school health staff being critical to our COVID-19 activities. They've been a critical part of our testing, contact tracing, results, phone bank, email bank work. They've been runners, data entry, administrative support. All that has been really critical to our COVID response. But as we're talking about what they've done, they've also done a lot of work on vulnerable populations, working with homeless shelters, service providers, nursing homes, assisted living facilities, the detention center, the food bank. I think it's a testament to what our school health staff do. Their core is to care. And during the pandemic, they have certainly put that into practice with the work that they've done in answering any and every need in the county. But part of what we wanted to do was pivot them back to the school health work. Some of that is supporting the non-public schools and their reopening plans, being able to provide not just assistance with those plans, but ongoing assistance with um, safe practices during COVID, and also working with them when there's cases and outbreaks in those non-public schools, and then also continuing to support our activities at the health department. Um, for the public school system, they've been working to reconfigure health rooms, train staff on mitigation strategies, isolation procedures, PPE, getting PPE, and then working particularly with the students who are back right now. So the special needs students, the tech students, and then the English language learners who are coming back to continue to provide school health services with those students. Depending on what the school board decides, they'll certainly be ready to provide services in the schools if schools open, and if not, they'll be ready to provide services in the community to continue our COVID work. Our oral rabies vaccine program is in its 23rd year. We've distributed over 84,000 rabies vaccines. And we've done more of them by helicopter this year due to issues with COVID. Once again, being able to access areas and getting our staff to be able to go out has been harder because they have been pulled, particular environmental health staff have been pulled to other COVID activities. And so we've done more via helicopter drops, 74,000. I had the opportunity to go up on one of those drops. It's amazing the work that they're doing and the precision with which they're doing those drops, and with the maps of the county, being able to precisely drop from about 200 feet to really curtail the spread of rabies in our county. Let's skip that. And just offer a brief overview of COVID before I wrap up. We've talked about COVID in our county. As of October 19th, we have over 10,900 cases and 251 deaths. And we continue to learn more about the virus and learn more about safety practices every day. Key to our ability to understand what's going on is understanding the case rate in our county, and our case rate is a way of really understanding what is the spread in our county and how does that compare to other counties and the state and other states. We see that since about June, after many of the restrictions from the stay-at-home order were lifted, not all of them, but many of them, we've seen a slow and steady increase, briefly interrupted by some spikes. And when those spikes has subsided, they've never subsided back down to the baseline that they came from. So you see that slow, steady increase. Our case rate now is at around 11 and a half, I believe. And concerning is that, I'm gonna skip that slide, is that it's the fourth leading cause of death. Now the blue bars you see here are the top 10 leading causes of death in Anne Arundel County in 2018, which is the latest year for which we have data. And that red bar is COVID-19 2020 data put into that graph. And what we see is that as of today, 7 months into the pandemic here in our state, it's the fourth leading cause of death. And we still have 2.5 months left to go. And so the impact of COVID-19 has certainly been felt. In our county, it's the fourth leading cause of death. In the United States, it's the third leading cause of death. I think one thing that's important to remember is that there are long-term health effects. While most people do have mild to moderate symptoms, about 10 to 15% of people have severe disease, and about 5% become critically ill. And those who do have severe disease do have long-term symptoms. And by long-term, I mean to date. Because this is an unfolding pandemic, it's a little hard to say what the endpoint on those symptoms will be. But we're seeing neurological symptoms like confusion and fogginess, pulmonary symptoms like shortness of breath and cough, and mental health symptoms like anxiety and depression that persist for weeks and even months after severe disease. And so this is certainly something that we think about as part of the goal of prevention is to prevent these longer term effects, particularly in those who are more vulnerable. And lastly, I just want to highlight the rapid response. We reassigned over 150 staff to new functions when COVID hit, created a new division for COVID, and have been rapidly adding staff to be able to carry out all of the work that I mentioned that's a core part of the health department, and add on the COVID work on top of that. And that work is a range of activities from education, testing, contact tracing, case management, our isolation and quarantine support, call center, community and business and agency guidance, enforcement, mental health resources, and vulnerable population support, including for nursing homes, detention centers, and homeless populations. That is the rapid version of an overview of the health department's activities for the past year. I'm going to get out of this, and I'm happy to take any questions or thoughts you have.
Thank you. I will open up to my colleagues. I see Ms. Hare has a question for you.
Thank you, Madam Chair. Jessica Hare, District 7. I'm going to ask a couple of non-COVID specific questions at this point. Thank you. Thank you for the presentation. On the suicides and the opioids that you touched on, I sort of have the same question, I guess, for both. And it is a little bit related to COVID, so I will say that. Do we have the year-over-year data in terms of, are we seeing a large uptick, a small uptick? Is it decreased? And I ask because I think the last year at this same time, October of last year, we had actually started to see a pretty good decrease in the overdoses and deaths from the opioids. And so I'm trying to track now how we're doing based on that.
Yeah, so for the opioids, we are seeing, we're seeing some increase in overdoses, and what we believe will be an increase in the deaths as well from opioids. We're waiting for that data. Some of that data is, particularly death data, takes a while to come through because it has to go through the medical examiner's office. So we don't have that. For the suicides, it's harder. That data does not get prioritized. Opioids are one of the few things that gets prioritized in terms of timeliness of reporting. And so we don't have a lot of good up-to-date data. The other limitation, you'll notice that it was 2018 data. It's because we typically get, we typically get data from Maryland Department of Health, and that's where most of our data is sourced from. By middle of the year, so for 2020, we should have gotten it in the summer for 2019 data. As you can imagine, they're behind, and 2019 data hasn't come out yet. So we're a little behind on our data, which limits our ability to even track what happened in 2019 as we close 2020. So, I don't have a great answer yet for what's happening this year, particularly with suicides, but we're trying to figure out ways to get at that information so that we can actually look at that in more real time.
Okay, for the opioids, do you have an idea year to date what the percentage increase is at this point?
I'll have to follow back up with you on the percentage increase. I just don't have them off the top of my head, but we do have some of that data.
Okay, thank you.
Ms. Lacey?
Thank you, Madam Chair. Sarah Lacey, District 1. Dr. Kalyana Raman, first I want to congratulate you and your entire and growing team on your extremely hard work and dedication to take care of the citizens of Anne Arundel County, not just in COVID, but in all the other things that you covered. I think it's extremely impressive, and I'm very grateful for the work that you're doing. My question is about the harm reduction kits and strategies for opioid use. I think in your slide you mentioned Brooklyn Park and Annapolis as being the two geographical areas of focus. Do you actually provide those services in other parts of the county? And if so, can you tell us a bit more about that? Because we do have significant numbers of overdoses in, certainly in other areas of my district and District 2 and et cetera.
I'm going to invite Sandy O'Neill, who oversees those programs, to join us on the panel to talk a little bit about that.
Okay, thank you. Sandy O'Neill, I am the Director of Behavioral Health, and I think that that is a very good question that you have asked. When we're looking at our harm reduction strategies, although that fit nicely on one slide, we have a variety of things that are happening. So some of those things are available and have been available across the county. So for example, naloxone or overdose response training is available regardless. And right now we're able to do that virtually. So that is pretty expanded in our area. Some of the others we are doing in Brooklyn Park and Annapolis, but we're also in South County. We're in using the library sometime is a nice place to where people can gather. So we have a plan to deploy the current resources as well as to expand what we are doing across the county.
Thank you.
Yeah, thank you. Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Good evening, and thank you for the presentation, Doctor. Quick question for you. I'm going to ask this sort of generally, and then I have a couple specifics, and I'll otherwise reserve all of my questions about COVID until we get to Bill 8320 later in the night, just in the interest of time. But I have gotten a number of contacts from constituents about the mask ordinances in the county and the way that they're being handled, particularly with folks who have a legitimate health issue. So for instance, I received an outreach from a constituent about her daughter who has special needs and cannot actually wear a mask to be able to return to school because she has actually chewed through shirts. That's part of what she struggles with. And so the question I would have is, how is the health department looking at the mask ordinance with respect to students with special needs returning to the classrooms, particularly because apparently my constituent that I'm referencing heard from a deputy superintendent that if a child can wear a mask for an hour, they get to come to school for an hour and that's it. They're strictly following the county's health department policies and procedures, which is different than what the CDC has said, where they've indicated that if masks can't be worn, then other social distancing measures and other measures to try to limit the spread of the virus should be undertaken. So that's one context of that question. Then the other context is I've had constituents who've reached out to me about going to stores who have legitimate health issues that prevent them from wearing a mask in public, and they have actually been stopped by the police, and they have been told by the police that they are not allowed to enter into the store and that they would be trespassing if they were to not wear a mask entering into the store. I've actually had discussions with the police department about this. They indicated to me that there would be some guidance. I believe I've emailed with you about this as well. So what is the health department doing both in educating businesses in the community and talking with the school system about dealing with masks when you have individuals who have legitimate health issues that make it so that they cannot wear masks?
Nilesh Kalyan, Department of Health. I'll take the school piece first, and then I'll talk about the police piece second. In terms of the school piece, it's actually up to the school to decide how they're going to have it, how they're going to be able to implement their mask policy. And the Maryland Department of Health and the Maryland State Department of Education has said that masks are required in schools. That is a part of their guidance that has come out. And we're certainly recommending that as well. We're not countering MDH and MSDE's requirements on that issue. And it's up to the school system to work with those students and those families to figure out how to provide the services those children need. We're there to support them and to help them work through any individual issues they have, and that certainly come up with our school health staff, and that's our role in that. So if I would say that if there are specific issues, like individuals that you're aware of, certainly please, you can forward them to us, and we can work with the school system to understand what's happening. But they do have to make those decisions as to what they can accommodate and how they do that. On the issue with police, the mask order for the general public, There are exceptions for when masks need to be worn, um, and medical exemptions are part of that. And there's no proof required for that. That's actually explicit in our health order. That said, that stores get to make their own policy, and if stores are expected to have reasonable accommodations for shopping or for whatever service they're providing, but they're not required to serve people if they don't want to. And so, from an enforcement standpoint, we've provided a guidance, but stores and businesses have the right to enforce their policy as they choose.
Madam Chair, if I may.
Proceed.
Thank you. Nathan Volkey, District 3. Doctor, so I have a really pretty major problem with that statement that you just made, because these are individuals who, because of a health issue, i.e. a disability, are being denied access to a public facility. This is discriminatory on its face. I mean, the idea that we're going to sit there and say that a store is allowed to choose who they let in and who they don't because someone has a legitimate health issue, I think raises some very real concerns that the county should be aware of. I've had this discussion, again, like I said, with the police department, tried to raise this with them. I'm not sure where they are in terms of their guidance and where the health department is in terms of their guidance, but I do think that to the extent that we're treating people differently and we're saying that your access to a public facility is limited because you have a legitimate health issue, and the same is true for these students, where it does not sound like much in the way of any reasonable accommodations are being made, but we are actually treating people differently because of their health or a disability. That strikes me as definitionally discriminatory. So if you care to address that, that's fine. If not, I could just let it sit there. But that's a major concern that I have with the response that you just provided.
Noel Kalyan, I'm at Department of Health. I just want to clarify, when you say public facility, are you talking about public spaces, or are you talking about private businesses or schools, which are different? Like
I'm saying,
talking about.
Sure. I'm saying if an individual was attempting to go into Walmart and someone called the police at Walmart and said, we don't want this person in because of their race or their gender or their sexual orientation or any other immutable characteristics that we're talking about here, there is no chance in the world that the county police department would show up and say that person is going to be denied entry, and if they go in, we'll arrest you for trespassing. Period. End of story. Would never happen. So the idea that we're doing it with people who have legitimate disabilities absolutely floors me.
So when you bring up Walmart, it's not a public facility, it's a private organization. They have to enforce the rules as they see fit. One of the things that we've talked about with businesses is that they need to have reasonable accommodations, and one of those things have been that mask usage is not an immutable characteristic. And this has to do both with not just safety for that individual, but safety for the other individuals as well. This is one of the hard things about COVID, is that during a time of an infectious disease, our actions don't impact just ourselves, they impact others. And so those businesses, it is upon them to figure out how they can reasonably accommodate people. I can't speak for every single instance that is out there. I understand the frustration behind that, and we have worked with many businesses to figure out what those reasonable accommodations are. So once again, I'm happy to work through specifics with my team, and we've certainly done so in the past. But those reasonable accommodations are meant to also safeguard the health of others who are in that store or business at that same time. And this is the area where we need to have an ability to work through some trade-offs. I know that's not a satisfactory answer on a blanket, but this is where the nuance and the judgment are used, not just by ourselves, but particularly by businesses.
Madam Chair.
Sure, you can proceed, but you do have colleagues waiting, so go ahead.
Understood. Thank you. Nathan Volkey, District 3 again. Doctor, I appreciate that. I wear my mask when I go in public. I know that there's been a lot said about, people who do or don't wear masks and all this. What I'm trying to get at is, I understand the point you're making about how actions affect other people. I'm not trying to deny that. I'm not someone who's sitting here suggesting that people should be running around without masks on. That's not what I'm saying. So let's be clear about it. But what is frustrating to me is the idea that I understand you're saying Walmart is a private actor, but when you bring in the police force, you've now involved the government. You've now used a government actor, and that now invokes constitutional protections, which are available to everyone. And the idea that we're going to say that the use of a mask or not is, something that's required, the immutable characteristic is not the mask. The immutable characteristic is the underlying health issue that this person has that they have to deal with. And the accommodation is to work with them and try to help them get access to facilities just like anyone else without a disability or without the immutable characteristic so that they can live their life the same as others. And I think that that's where the distinction is really being lost. And I'm not suggesting a blanket policy, but what I am suggesting is that the county police force and the county health department understand that if someone is asked, why are you here without a mask? And the person says, because I have a legitimate underlying health issue that prevents me from wearing a mask, the county police officers should back up. They should not be able to enforce for Walmart, this person can't go in, or Safeway for the instance that I'm dealing with and that I've dealt with personally with someone in my district. That's the problem. And if Safeway wants to hire private security guards who say this person is not allowed to come in, that's different. Now we haven't invoked a government actor. But by bringing in the police department, we have. And I think that that is really disturbing to me, that there's not more of an understanding about this when we are talking about people who have these disabilities who are not able to wear these masks. I respect the idea that we need to all wear masks as much as possible, but sometimes it's not the reality for folks. So I would hope you all can address this.
Ms. Fiedler?
Thank you, Madam Chair. A follow-up to that and then a separate question, not COVID related. I'm going to save the majority of my questions for later this evening. Have you or anyone from the health department heard or spoken with anyone in the deaf and hearing impaired community? And let me back up a minute. One of the businesses that was initially given a notice to comply was because they were wearing a shield versus a mask. And one of the reasons that they were doing that is they have a very regular customer who is deaf and relies on being able to read mouths for those who don't know how to sign language or communicate via sign language. I don't know if this is something that's been heard in other areas of the county. So I'm just interested if there's any communication going on with that community to identify challenges that they are having during this time communicating with the general population.
Sorry, Nilesh Kalyanaraman, Department of Health. In our health order, we've made a specific exemption for those who are deaf or hard of hearing, precisely for the reason that you note, Councilwoman Fiedler. As to specific conversations with that community, I'm not aware of that. We would certainly be open to that if there are specific concerns or steps forward that that would be helpful.
Okay, thank you. And maybe that's a conversation that we can keep open in the future work group meetings and such. I did want to ask a separate question, not COVID related, as I mentioned, when we were looking at the statistics or discussing the statistics for opioid overdoses, we did touch very briefly in one of the slides on pregnancy and use. Does the health department track NOS statistics, the neonatal abstinence syndrome? And if we do we see an increase in numbers? Or are we seeing more babies born with NOS effects?
Excuse me, Nilesh Kalyanaraman, Department of Health. I'm going to bring Sandy O'Neill back. Do we track those sort of things? Yes, I'm not sure that we get data at in a real-time way or not about that. We have our fetal infant review team, but I'm going to turn it over to Sandy to give us a little bit more detail there.
Sure, Sandy O'Neill, Department of Health. We partner with the Department of Social Services. They get those statistics for substance exposed newborns, and that is tracked. And we actually have several programs throughout the county. The Department of Health has some, as well as in partnership with the Department of Social Services, specifically for substance exposed newborns and their families.
Okay, Madam Chair, if I may continue with a follow-up.
You may proceed.
Thank you. Do you have the most recent statistics when those are from, and would you be able to provide, let's say, a year-to-year look at those statistics?
I will have to get back to you on that. Yes, I've seen those numbers and I believe that they can be made public, but I will follow up with you to get you those numbers.
Thank you so much.
Mm-hmm.
Ms. Rodbian?
Thank you, Madam Chair. I just have a couple follow-up questions on things that my colleagues raised. Dr. Kalyanaraman, you mentioned that a store that, we were going with a Walmart example, would be able to, enforce their own policy regarding mask wearing, but they would need to provide appropriate accommodations. Do we have any guidance, I don't know, from the Office of Law or maybe the state government in terms of what kind of accommodations would be appropriate or what kind of accommodations could be made in those situations? Because I really am envisioning a situation where a person with a certain disability, and to be perfectly honest, I'm not familiar with, the kind of disabilities that would make mask wearing, unsafe, but I recognize that they're out there. So feel free to share examples. But at the same time, if a person needs to, go and buy their groceries, they need to go and buy their groceries. So what kind of accommodations are you aware of that, I guess different retail entities are providing for customers that require them? Or, for example, in the case that Councilwoman Fiedler raised with respect to someone who is hearing impaired and relied on lip reading.
Nilesh Kalyanaraman, Department of Health. So this has come up a number of times, particularly, and there's kind of two different instances. One is temporary inability to use a mask due to an illness of some sort, and then a more long-standing due to chronic conditions. We've gotten the question more in the context of the chronic conditions setting. So things like groceries or other needs. I know some stores have worked to provide through like online delivery or online pickup services, or one way to get at that, to be able to provide the service of groceries or other needs, other material needs, without having to go in the store when you can't wear a mask. A lot of places have approached it as no shirt, no shoes, no mask, no service. So within that kind of construct of, from a public health safety standpoint, that it's another article of clothing for protection. It's hard to say specifically for the deaf and hard of hearing community because we haven't really gotten much in terms of feedback of individuals not being able to access services. That doesn't mean it hasn't happened. I'm just not aware of it. I'm certainly going to go ask tomorrow to see if it's come up. But typically I do hear about these things and I haven't. So if there's specific instances that you're aware of, any of you are aware of, please do bring it to my attention.
Ms. Rodbian.
Thank you, Madam Chair. Lisa Rodbian, District 6. I have an unrelated question. So I appreciate that. I think maybe I would just maybe suggest that we get maybe some guidance for retail entities so they know how to provide. And it sounds like, delivery using an online service would work for a lot of things, but we need to make sure we have bases covered. I actually haven't encountered, but maybe Councilwoman Fiedler can provide details on the situation she described with a constituent who's hearing impaired. My other question was, you had mentioned that, we are seeing that COVID can result in long-term or long-haul syndromes. And I realize that any data we have is probably, fluctuating at this point, but do we have an idea of the frequency? You said about 15% end up in a serious, I think I'm remembering correctly from your presentation, 15% end up with, serious, need serious attention. And then, I think I'm guessing maybe this is acute care versus ICU care, 15% and then 10%. But with respect to the long haulers, do we have an idea of what percentage of the cases result in those long haul syndromes?
So the majority. When we talk about severe disease, we're talking about people who've required hospitalization in some shape or form. The majority of people who've been hospitalized have some long-term symptoms. The reports vary. That's data that's still being collected, but the vast majority have some symptoms. The majority have some pulmonary symptoms, and then mental fogging, cloudiness is also a frequently noted symptom. And then there's a range of other symptoms with that are not as common, but certainly do happen.
Okay, thank you. That gives an idea of, where we at least are likely to be at. Thank you.
Do we have any other questions for Dr. Kalyana-Raman this time? I don't see any further questions regarding your presentation, Dr. K. I would like to echo the sentiments of Madam Vice Chair. Thank you for the hard work that your department does every day and continues to do in the community. And we will end our Board of Health meeting at this time. So thank you for being with us and bringing your team. I'm sure we'll see you a little later in the evening.
Indeed. Thank you all. See you later.
So I want to remind everybody that we'll be taking a 10-minute recess at the 7:30 mark, but we're going to continue through the agenda. May I have a motion that the partial reading of any bill, resolution, amendment to a bill or resolution, or minutes constitutes the reading of the whole?
Lacey, so moved.
May I have a second?
Councilman Pruski, second.
All in favor? Aye.
Aye.
Aye. Aye.
Aye.
Thank you. Any opposed? None. The motion carries. Madam Secretary, please read the minutes of the meeting of October 5th, 2020.
The meeting was called to order by Chairman Allison Pickard at 6 p.m. Ms. Rodbean gave the invocation, followed by the Pledge of Allegiance. The meeting was held remotely via Zoom webinar, beginning with a roll call of all present.
May I have a motion to approve the minutes of October 5th, 2020?
Lacey, so moved.
May I have a second?
Councilman Pruski, second.
All in favor?
Aye.
Aye. Any opposed? Seeing none, the motion carries. The minutes of October 5th, 2020 stand approved as read. Madam Secretary, please read the titles of any bills to be introduced this evening.
Bill number 8920, an ordinance concerning public safety, animal control and animal control commission, renaming and repurposing. Bill number 9020, an ordinance concerning zoning, data storage centers. Bill number 9120, an ordinance concerning Snug Harbor Special Community Benefit District. Bill number 9220, an ordinance concerning current expense budget, supplementary appropriation, North Beach Park Special Community Benefit District. Bill number 9320, an ordinance concerning public ethics definitions. Bill number 9420, an ordinance concerning public safety, public nuisances prohibition.
Thank you. Madam Secretary, please read the titles of any resolutions to be introduced this evening.
Resolution number 4220, resolution recognizing Sunday, November 1, 2020 as Maryland Emancipation Day in Anne Arundel County.
Thank you. May I have a motion to suspend the rules to vote on resolution numbers 35-20, 36-20, and 37-20 before the public hearings and call of bills for final reading and vote?
So moved, Councilman Andrew Pruski.
May I have a second?
Lacey, second.
Madam Secretary, will you call the roll on the motion, please?
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Nay.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye. Aye.
Ms. Rodvian,
Aye.
Ms. Pickard.
Aye.
6 in the affirmative, 1 in the negative. The motion to take resolutions 3520, 3620, and 3720 out of order is passed.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. I would move to, I would request a motion to both have a hearing and vote on Resolution 42-20 this evening, and in whatever order it fits our agenda.
I would recommend having a specific motion to vote on Resolution 4220 at a particular, perhaps.
At the end of our meeting, perhaps. At the end of our meeting. Thank you.
Is there a second?
Councilman Persky, second.
Madam Secretary, will you call the roll on the motion to hear and vote on Resolution 4220 at the end of this meeting this evening?
Ms. Hare,
Aye.
Ms. Lacy,
Aye.
Mr. Volkey,
Nay.
Mr. Pruski,
Aye.
Ms. Fiedler,
Aye.
Ms. Rodvian,
Aye.
Ms. Pickard.
Aye.
6 in the affirmative, 1 in the negative. The motion to vote on resolution number 4220 at the end of the meeting is passed.
Thank you. Madam Secretary, please read the title of resolution number 3520.
Resolution number 3520, resolution approving the application to the United States Department of Justice, Office of Justice Programs for a grant under the Edward Byrne Memorial Justice Assistance Grant Program, Federal FY 2020 local solicitation, and recognizing the county executive's authority to act in connection with the grant.
Thank you. This is a county executive resolution. Mr. Barron, you have the floor.
Good evening, Madam Chair, members of the council. Pete Barron with the administration. Joining me from the Office of Law is Mr. Tyler. We've done a resolution similar to this previously. This resolution 3520, is required under the terms of a grant that we have a resolution passed by the county council. The amount of the grant this year is $139,095. There is no matching funds required. The grant monies will be used for a contractual paralegal for the state's attorney's office for drug court to provide mental health services to approximately 75 incarcerated county residents who are uninsured and have mental illness and substance dependence, juvenile reentry navigator position, a community conferencing program. With that, we ask the council move the resolution.
Are there any questions from my colleagues for the administration regarding this resolution? Seeing none, before we open the public hearing, I'll just embarrass my colleague, Mr. Barron. Happy birthday, sir. Thank you for joining us.
Thank you, ma'am.
I won't ask you how old you are. We'll now open the public hearing on resolution number 3520. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we have not had no submissions of written testimony on resolution 3520.
Thank you. We did not have any of the members of the public sign up to speak. Therefore, the public hearing on resolution number 35-20 is now closed. Madam Secretary, please read the title of resolution number 3520.
Resolution number 3520. Resolution approving the application to the United States Department of Justice, Office of Justice Programs for a grant under the Edward Byrne Memorial Justice Assistance Grant Program, Federal FY 2020 local solicitation, and recognizing the county executive's authority to act in connection with the grant.
Any further discussion? Not that we've had any, but any further discussion? Thank you. Madam Secretary, please call the roll on resolution number 35-20.
Ms. Hare,
Aye.
Ms. Lacy,
Aye.
Mr. Volkey,
Aye.
Mr. Pruski,
Aye.
Ms. Fiedler,
Aye.
Ms. Rodvian,
Aye.
Ms. Pickard.
Aye.
7 in the affirmative, none in the negative. Resolution number 3520 is adopted.
Thank you. Madam Secretary, please read the title of resolution 36-20.
Resolution number 3620. Resolution approving the determination of certain unimproved county-owned property being part of Old Admiral Court in Annapolis, Maryland, located between properties known as 711 Bestgate Road and 713 Bestgate Road in Annapolis, Maryland as surplus property.
This is a county executive resolution. Mr. Barron, you have the floor.
Thank you again, Madam Chair. Pete Barron with the administration. Joining me from Central Services is Ms. Harris and Mr. Walker. From Law, Ms. Niederer. This resolution, you may recall, was we are rebringing it forward, if I can say it like that. We had to withdraw a previous resolution due to not following the proper process. I want to thank Madam Auditor for pointing that out. It is important that we do these things right. This is a property located in Annapolis. It is comprised of one parcel at the southerly right-of-way line at Bestgate Road. As you'll recall, the administration's previous resolution, we brought under the process required for a piece of parcel of less than a tenth of an acre. We were dismayed to learn that you don't get to round down. This property is 0.0029 acres over that threshold. I used Google. It's 126 square feet. So it is a little bit too large to be done under the previous process. We want to apologize for our misinterpretation, and the resolution brought before you is brought forward under the proper process. Like I mentioned, this property is just over a tenth of an acre. It is 0.1029 acres. In your packet, you will have a map of the surrounding area. If the council approves tonight, the real estate division will proceed with disposing of this property in accordance with the county code. We ask you to move the resolution tonight.
Thank you. Are there any questions from the council? Seeing none, we will now open the public hearing on resolution number 36-20. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we've received no submissions of written testimony on resolution 3620.
Thank you. And we did not have any members of the public sign up to speak. The public hearing on resolution number 36-20 is now closed. Madam Secretary, please read the title of resolution number 36-20.
Resolution number 3620. Resolution approving the determination of certain unimproved county-owned property being part of Old Admiral Court in Annapolis, Maryland, located between properties known as 711 Bestgate Road and 713 Bestgate Road in Annapolis, Maryland as surplus property.
Thank you. Is there any further discussion? Seeing none, Madam Secretary, please call the roll on resolution number 36-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian? I'm sorry, Ms. Rodvian?
Aye.
Thank you. Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Resolution number 3620 is adopted.
Thank you. As this is a nice I think this is a nice break in between resolutions. May I have a motion to recess for 10 minutes, returning at 7:35?
So moved, Councilman Persky.
Is there a
Second,
second?
Councilwoman Rodvian.
All in favor? Aye.
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 The motion carries. We will return at 7:35. Thank you, everyone. Madam Secretary, will you please call the roll?
Ms. Hare,
Present.
Ms. Lacy,
Present.
Mr. Volkey,
Present.
Mr. Pruski,
Here.
Ms. Fiedler,
Present.
Ms. Rodvian,
Present.
Ms. Pickard.
Present.
Madam Chair, all council members are present.
Thank you, Madam Secretary. Madam Secretary, please read the title of resolution number 37-20.
Resolution number 3720. Resolution approving the application of Eleanor R. King to sell an agricultural land preservation easement to the Maryland Agricultural Land Preservation Foundation on 67.5 acres in Davidsonville, Maryland.
This is a county executive resolution. Mr. Barron, you have the floor.
Good evening again, Madam Chair. Pete Barron with the administration. Joining me from Rec and Parks is Ms. Polito, and from Law, Ms. Niederer. The King property located on Doublegate Road, Davidsonville, lies within the General Development Plan Priority Preservation Area and includes 67.55 acres. The current farming operation includes 62 acres of small grain rotation, 5 acres of woodlands. The farm contains 50% class 1, 2, and 3 soils. The farm has a current soil and water quality conservation plan in effect. Protecting this farm from development will add to an existing 450 acre block of land within a 1 mile radius already under a preservation easement. With that, we ask that you pass this resolution.
Are there, Ms. Hare?
Thank you, Madam Chair. Jessica Hare, District 7. Let me start by saying I'm supportive of this resolution, but I have a question on the practical impact because it's my understanding in reviewing the application, the land is actually 69.5 acres. 67.5 acres is going to get this ag preservation. And there's a reservation of 2 acres pursuant to, the application says they're withholding essentially 2 acres. I don't see a map anywhere attached to the application. And I'm just wondering, do we actually, have we designated which 2 acres are going to be withheld and which 67.5 are getting the easement?
Pete Barron with the administration. I'm going to ask Ms. Polito to give us a little more detail on the specifics of the application.
Barbara Polito, Recreation and Parks. Yes, the 2 acres is designated, and it is located on the map that's attached to the resolution.
I don't have a map attached to the resolution.
It should be.
That's, you should. It's an exhibit. The 2 acre lot is up front. The reason for it, the MAP program allows a landowner to withhold acreage for the future, okay? And so what happens when they withhold 2 acres, that means 1 development right is deducted from the offer that they'll receive. So they will receive less funding. But there is an exhibit to that resolution that you should have, and
if the map isn't attached, Councilman, we'll make sure you get it.
Okay.
Okay, thanks. I was curious because it struck me since I couldn't see it, but I believe you that there's a map, so I appreciate that. Thank you.
Okay.
Are there any other questions for the administration? We'll now open the public hearing on resolution number 37-20. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we received 3 submissions of written testimony, which we shared with the council and posted on the council website.
Thank you. We will now hear from members of the public who signed up ahead of time. We have 1 person signed up to speak on this resolution. Remarks will be limited to 2 minutes. When it is your turn, Please unmute yourself and begin by stating your name and address for the record. I have Miss Amy Britt. Miss Amy Britt, are you with us this evening?
I'm with you, but I did not intentionally sign up for this one.
Oh, okay. Were you looking to sign up on 42-20?
I thought I signed up for invitation to audience and then, the emergency powers bill.
Oh, okay. Well, I will move you to 83-20 if you'd like.
Yes, please.
Okay, thank you. Muted. The public hearing on resolution 37-20 is now closed. Madam Secretary, please read the title of resolution number 37-20.
Resolution number 3720, resolution approving the application of Eleanor R. King to sell an agricultural land preservation easement to the Maryland Agricultural Land Preservation Foundation on 67.5 acres in Davidsonville, Maryland.
Is there any further discussion? Seeing none, Madam Secretary, please call the roll on resolution number 37-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Resolution number 3720 is adopted.
Thank you. Madam Secretary, please read the title of Bill number 69-20 as amended.
Bill number 6920, an ordinance concerning zoning, farm or agricultural heritage site stays and special events.
This is an administration bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. Pete Barron with the administration. Joining me at the virtual table is Miss Lori Rhodes, our Deputy Chief Administrative Officer for Land Use, and from Office of Law, Miss Kelly Kenny. As I mentioned in the work session and the previous hearing on this bill, the county executive does have an interest in a land trust, which is a farm, and we have filled out the required ethics disclosure statements. I won't reiterate the points that have been made as we've discussed this bill in the past. I just do want to sort of hammer home a couple of quick points. This bill comes out of the work of the Agro-Tourism Commission. A lot of work went into create it. Collaboration, negotiation, many stakeholders were involved in the crafting of this bill. The Agro-Tourism Commission passed the recommendation on to the county executive unanimously, and that was then turned into the bill before you, with the obvious exception of the amendments that were accepted at the previous meeting. The point of this bill is to allow an additional, or to allow an accessory use to farming. So to be clear, a farmer will still have to farm to take advantage of the changes included in this bill. And to be clear, there was a 2017 bill which did not set limits, and this bill does include several places where we put limits on certain uses like site stays and special events. So with that, I understand there's some amendments that will be coming. I want to thank the maybe I should wait to thank the maker of those amendments for sharing them with us in advance. And we're happy to answer any questions that the council may have.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I will reserve the bulk of my comments for my amendment that's coming up in a little bit. But I wanted to touch on this concept of accessory use one more time because I'm still getting a few concerns from constituents, and I want to make sure that the record from a legislative standpoint is abundantly clear on this. I had asked, I believe, at the last meeting to Ms. Rhodes about this concept of accessory use and how we define it as sort of subordinate and incidental to the primary use on a property. I then thought to myself, maybe I could define accessory use. Maybe we could craft it in a way that would be related to the economics of a farm or might be related to the acreage of a farm. But I am struggling to do that in any equitable fashion. And so I'm hoping, Ms. Rhodes, for the benefit of the public, you can just give me a little bit about what is planning and zoning looking for to make a determination that a special event or a site stay is going to be an accessory use to the farm. If it's a list of considerations that you go through or just things you look for to help the general public understand that this does have to be an incidental or a subordinate use.
Thank you. Good evening. Lori Rhodes, Deputy Chief Administrative Officer of Land Use. Accessory use, as we interpret it in planning and zoning, is a use that is subordinate, which means it can't exceed the primary use. So for example, in the case of a 10-acre farm, less than 50% of that property would be used for the accessory use. So you couldn't use more than 50% of the property for an accessory use. 50% or more of that property would have to be devoted to farming. And that's how we would distinguish accessory from the primary use in the case of agricultural related uses.
Okay. When you get to sort of maybe a 200-acre property or a 100-acre property, do you still have that same sort of 100 acres has to be farmed or 50 acres has to be farmed, or is there other considerations you might, I mean, if I take a 200-acre property and I see 99 acres being farmed, to me, that still looks like it's an accessory use, but does that meet that definition that you're talking about, or how flexible is?
Yes. Lori Rhodes, if it were a 200-acre farm, at least 100 acres or more would have to be in farming. And of course, you couldn't have less than 100 acres devoted to stays because it probably wouldn't meet the health department requirements and other impacted agencies, fire, etc. But that's how we would distinguish it. A 200-acre property, 100 or more acres would have to be devoted to farming, and less than 100 would have to be devoted to the accessory use in order for it to be accessory. It cannot exceed the primary use of the property, which in this case would have to be primarily farming.
Okay, if that same 200-acre property, if you had 99 acres being farmed and 2 acres being used for a special event or so, is that acceptable? Or because it sounds to me like you're saying that's not acceptable, but I just want to make sure I'm understanding where that line is.
Yes, the majority of the use would have to be devoted to the principal use. So it would be the acreage. In this case, we would look at the acreage as being the primary activity taking place on the property. So more acreage would have to be in farming and less would have to be devoted to the accessory use. And if it were floor area, we would be looking at more floor area devoted to the principal use and less floor area devoted. It's just like if you have a house, your single family dwelling. The principal use is the house. The accessory use would be the garage, because if the majority of the floor area was devoted to parking of vehicles, then it would become warehousing and it would no longer be the dwelling. So that's how we distinguish principal versus accessory.
Okay, thank you very much.
Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. This question, I believe, is also going to be for Ms. Rhodes, and I actually have more than one. For the life and safety inspections, can I assume that includes the fire marshal? And in those inspections, can you just touch on some high points on what is being reviewed for life and safety?
Lori Rhodes, I can't speak for the life safety code because I do not know all the particulars that are in it, but yes, it would include building as well as fire inspections. That would be considered the life safety inspections. but I can't
Okay.
tell you exactly what the fire marshal would review in the life safety code.
Understood. Amanda Fiedler, District 5, follow up to that. Would that then be given a green or a blue notice in our system, or would it just be internal inspection documents?
Lori Rhodes, yes, we do plan on providing policy guidance on how to interpret the laws and to give direction on what agencies would have to be reviewing the use, the life safety agencies. We currently do engage with the health department, inspections and permits all the time for existing uses, temporary uses and all uses. So it wouldn't change with this use.
Okay, thank you for that. And Madam Chair, I just have one more question, if I may.
You may proceed.
Thank you. Amanda Fiedler, District 5. I don't know who this would be best directed towards. For the events that are under 9, will there be any kind of notification or way for the general public to follow, or just be in the general know that someone has applied for the smaller type scale use?
Lori Rhodes, for the events 0 to 8, there will not be notification, but as part of the process, they would have to prove that the use will not have any adverse effects on adjacent property owners. So there would have to be some sort of discussion about what events will take place in order for them to satisfy that criteria that they've had a conversation with their neighbors about the events.
That makes sense. Thank you.
Mr. Pruski?
Thank you, Madam Chair, Councilman Andrew Pruski. I do have one comment and then a quick question. I know it was raised. Somebody was passing around a chart publicly that I had the second most properties that would be impacted by this bill. What people fail to mention, though, is I think 3% of those properties actually have farms on them. So I'm glad that the accessory use was defined. But I do have a question for Ms. Rhodes about enforcement. So if somebody does have an event and there is a complaint, would they do that through the 311 app? Would they file a complaint with the zoning and planning and zoning office? Again, just like any bill that we pass, there's always has to be some enforcement. So if you could just somehow address that, then how that would be covered, I'd appreciate that. Thank you.
Lori Rhodes, we would continue the enforcement practices that we currently do, and that would be enforcement received anonymously via the 311, by email, by letter, but it would have to be in writing, and that's how a complaint would be addressed.
Thank you. Are there any other questions regarding 6920 as amended? Seeing none, we will now open the public hearing on Bill number 69-20 as amended. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we have received 6 submissions of written testimony on Bill 6920, which was shared with the council and posted on the council website.
Thank you. We will now hear from members of the public who signed up ahead of time. We have 8 people signed up to speak on this bill. Remarks will be limited to 2 minutes. When it is your turn, please unmute yourself and begin by stating your name and address for the record. You will hear a buzzer at the 2-minute mark, and I will do my best to hold everybody to that 2 minutes. At this time, I'll start with number 1, Mr. Mike Lofton. Mr. Lofton, are you with us this evening?
I am. Can you hear me?
Yes, we can, sir. Go ahead.
Okay, very good. I'm Mike Lofton, 508 Polling House Road, Harwood, Maryland. I spoke at the October 5th meeting, and that's really why I'm speaking tonight. I urged you not to adopt this bill, and in part because the public has not been engaged in a meaningful way. And I did believe that to be true, and I continue to believe that to be true. Shortly after I testified last time, Mr. Riddle, the vice chair of the commission, asserted that I had misled the council on this matter and that there was a Growth Action Network board member that participated in the development of the legislation. And I'm sure he's referring to Pam Bush. Pam was appointed to the commission in following County Executive Pittman's election, and she attended her first meeting in January of 2019, and then attended 2 additional meetings in April and October of that year. of last year. Of course, the legislation didn't become available until this spring. At the 12/12/19 meeting of the GAN board, Pam reported that she had a significant concern over the lack of public comment and lack of transparency on issues before the commission. Pam died 12 days later. She never saw the bills, and GAN was not represented on the commission after that point. So there has not been meaningful public participation on this. And I think the kinds of questions that are being asked are reflective of that. Had this been at least, it's interesting because at the April meeting of the commission, they talked about having a town hall, and that never happened. So I don't really think there's been any outreach. The commission never did invite or accept public comment. You know, you go back and look at their agendas. There's nothing on any of their agendas that invites public comment. I've chaired commissions. That's a strange way to run these kinds of things. So I don't think information has been provided that warrants adoption of this measure.
Thank you, sir.
Mm-hmm.
We'll move along on our list. Ms. Tamara Furlong Whitfield, are you with us? Ms. Tamara Furlong Whitfield, have you joined the meeting this evening? Okay, we'll move on to number 3 on the list. Ms. Maria Price Nowakowski, have you joined us this evening?
Yes. Can
Ms.
you hear me?
Yes, we can hear you. Please state your name and address, and you have 2 minutes, ma'am.
Okay, my name is Maria Price Nowakowski. My address is 8117 Beverly Road in Severn, Maryland. And my concern about agritourism, with increasing development, loss of habitat, and farms disappearing, it makes it very important for people to make a connection with farms and nature to realize where their food comes from and how to help restore the environment. If people don't understand how damaged our environment is, they won't care about restoring the environment at all and have good agricultural practices that don't degrade the environment. We have rampant obesity and chronic diseases that are related to diets composed of manufactured factory food. All of this costs our government money. If people learn to value farms for the production of vegetables and fruits, they might learn to have healthier diets and better health. Agritourism can educate people on how to use the natural world to have better health. Tasting what local farms can produce can help people change and desire a healthier diet. Make it easier for farmers to allow people to sample what they are growing locally. And we are also losing our pollinators, which will lead to poor food production. If people tour and see what pollinator attracting plants can do, they will be more prone to restoring the plants in their own gardens. That's my opinion.
Oh, I'm muted. Thank you. Next on the list is Mr. Paul Christensen. Mr. Christensen, have you joined the meeting? Mr. Christensen?
Yes, can you hear me?
Yes, sir, we can.
Okay, fine, thank you. Okay, my name is Paul Christensen. I live in Tracy's Landing. I'm one of the neighbors who could be affected by this bill. I'm not a farmer, but I live near several ag properties, and I'm also a member of Growth Action Network, but tonight I'm representing myself. I made publicly available and provided the council a GIS map that shows more than 650 ag and historic parcels subject to this bill, and the more than 50,000 residential parcels within 1 mile of them. Similar maps will the county suggest there may be more parcels. These parcels are concentrated in District 7, but every council district has several agri-historic parcels, and perhaps more importantly, hundreds to thousands of residents within earshot of them. These are shockingly large numbers, and they show that this bill proposes mass rezoning that could impact many constituents of every council member. At this scale, unforeseen consequences are almost guaranteed to occur. Every council member should be paying careful attention. The problem is that all of this is new for everyone involved. We have no experience with it, and we just don't know what we don't know. There's lots of speculation about both positive and negative impacts of the bill, but let's not just speculate. Let's get some actual data before we leap off of the precipice. We need to approach this issue with a pilot study or legislation of limited duration with a sunset date. Either of those approaches would generate information from
It's quiet out there.
farmers and neighborhood neighbors that will let us sharpen our vision of the path forward and make adjustments if needed. Please give this bill your full attention and don't pass it without amendments that will ensure slow and thoughtful scale up. Thank you.
Thank you, sir. Can I just mention, Miss Lori Rhodes, if you can hear us, you need to make sure you're muted. We're going to move on to number 5 on my list, Miss Sarah Campbell. Miss Campbell, are you with us?
Yes, I am. Can you hear me?
I can. You have the floor. You have 2 minutes. Please state your name and address for the record.
Sarah Campbell, 4956 Muddy Creek Road, West River, Maryland. I am a farmer and I'm asking you all to support Bill 6920 and the proposed amendments. This bill will help farmers by creating economic opportunities, and it will help us preserve our county's agricultural heritage. I'm a farmer myself. I'd like to have farm stays at my farm, and I would really appreciate a legal path forward. I'm also a multi-generational farmer, and I'm really concerned that farmland won't be available for the next generation. Agriculture is evolving, and one of the ways it's evolving is in the growth of agritourism. We need to keep up with this, and our rules and policies need to evolve alongside our industries, and that's really what we're asking for here. And it's not our intent to change the landscape or the rural feel of our community, but to share it with those who can appreciate it, and while increasing revenue to local farms and businesses. I would also like to voice my concerns about farm stays being a special exception rather than a conditional use. I think farm stays, given their low impact and intimate small group nature, should be considered for conditional use. This would be consistent with other conditional agricultural activities that are permitted. And the special exception process is going to be expensive and burdensome, but doesn't create or provide any additional safeguards for farm visitors. With a conditional use, farmers would be subject to the same level of approval and review by health and fire departments. As farmers, we're going to make a lot of investments in order to offer farm stays, and I think it would be important to sort of free up those funds to make them in health and safety measures. And I don't think that having farm stays on my farm is going to burden or disturb my neighbors. The goal of this was to find a way to create opportunities for the public to learn about agriculture, experience working farm, and get away from the hustle and bustle of city living. It's going to be quiet, it'll be intimate, it's designed to be relaxing. And I think that this proposal is going to help people and create a lot of wonderful opportunities in our community and help preserve family farms in a time where the farm economy is increasingly unstable or contracting. And I encourage you to support this bill.
Thank you, Ms. Campbell. Next on my list is Ms. Anna Cheney. Ms. Cheney, have you joined the meeting?
Yes.
State your name and address for the record. You have 2 minutes.
Thank you. Anna Cheney, Honey's Harvest Farm, Lothian, Maryland. Thank you, Madam Chair, council members. I appreciate all that you've done to support agriculture and all that you do here in the county. As a lifelong resident with a long lineage here in the county, it's my desire and it's actually my duty to help preserve the history and culture of this area, of which agriculture and farming are such a huge part. As the chairperson of the Agricultural Farming and Agritourism Commission, it is my responsibility to work to understand the needs of farmers and provide recommendations to our county executive as to the continuation, growth, preservation, promotion, and sustainability of our county's farms. This legislation provides the opportunity for our working farms that are producing agricultural goods as the primary use of their farmland to engage in up to 2 accessory uses, short-term overnight farm stays and special events. This opportunity can be the difference between staying in farming versus selling to developers or just simply moving out of the area to continue farming, where farming is welcome and supported wholly in its evolving space that often includes public interaction on farms. Please note that this bill is intended and written to protect our county from the fake farmer or potential investor who doesn't really farm their land nor care about our agricultural heritage, landscape, and our community. To be assessed as a working farm, one must provide tax returns showing their farming revenue and/or have an active farm plan in conjunction with the Anne Arundel Soil Conservation District. This legislation was drafted by our county's Office of Law with the clear intent of helping our working farms and farmers. The Office of Planning and Zoning and Director thereto have accepted responsibility in assessing the authenticity of a farm and farmer insofar as a primary use of the farm. I realize that while nothing is perfect, we are all doing the best that we can, including our county administration, P&Z, our community members, our Ag Commission, and this council. I therefore ask you to pass this legislation with the proposed amendments presented this evening and to work to uphold the intentions thereto with the utmost integrity. I'm available to answer any questions you may have about the commission and the unanimously voted recommendation supporting these two accessory uses on working farms. Thank you so much.
Thank you, Ms. Cheney. Next on my list is Ms. Patricia Lynch. Ms. Lynch, have you joined the meeting?
Yes, I'm here. Can you hear me?
We can. Ms. Lynch, you have 2 minutes.
Thank you. Pat Lynch, 1648 Homewood Road, Annapolis, 21409. I am speaking as a private citizen. I am also the acting chair of Growth Action Network. And I want to state unequivocally that we support our farmers and their interests and intent to expand offerings from their farmed properties. We as community advocates also support the hundreds of property owners and probably thousands, as we've already testified, near these farms whose activities could bring noise, traffic, pollution throughout the many hours of operating farm events. We have received statements of concern and some objections to prospective gatherings at these farm festivals that can last until 11 o'clock at night when many families are headed off to bed. A special concern is a large number of attendees who, according to this bill, will be allowed to enjoy those events for hours at a time. 200 people may attend an event on a 10-acre farm, which sounds vast. However, if an event was held on a 20-acre, double the size parcel, the density would not ease up because the density in the main site really would not change as the wine, beer, festivities, and the structures needed, tables, chairs, etc., will all be probably centralized still on the first 1 to 2 acres to serve these people, and also the concern over staging for musical events. Roadway and parking will also be near the festival site, further concentrating the crowds and activities on a central part of a larger parcel. If problematic, you can only call the Anne Arundel County Police so many times to a single location. In closing, we want and need farm events, but we also need strong and prudent limits on the number of attendees invited to these events. I hope to be there to join you in the fun. Thank you very much.
Thank you. Next on my list is Jessica Clark. Ms. Clark, have you joined the meeting?
Yes, I have.
Thank you. State your name and address for the record. You have 2 minutes.
My name is Jessica Clark. My address is 8970 St. Andrews Drive in Chesapeake Beach, Maryland. And I would like to express my support of Bill 6920 and ask that the council support the bill as well. Agriculture is alive yet threatened in the state of Maryland. As one of the top 10 industries in the state, agritourism is a key element in keeping our agricultural land in active farming. As our families become more removed from life on the farm, we see a rise in popularity and demand for agritourism. Most importantly, when people connect with the farmland and the fresh local food and the farmers who grew it, they then value the land and want to preserve it, which is the beauty of agritourism. This bill is vital to allowing farms to continue farming as they provide the opportunity for farmers to host a limited number of special events and to offer farm stays for guests to connect with the land and the farm. This provides accessory income to working farmers who are wanting to make a living on the farm and ensure they can hold on to their farm for generations to come. Farm stays should be conditional and not a special exception use to be helpful to farmers as an accessory use. Another benefit of special events at farms in Anne Arundel County is that residual local businesses will benefit. Special events will employ caterers, florists, bakers, transportation companies, and lodging in Anne Arundel County. While people are visiting the area, they will visit local restaurants and markets. These local businesses employ local residents who will also see the financial benefit of these events. The concerns of traffic and noise are non-issues due to the conditions set forth in this bill, requiring proper parking and screening of activities from neighbors. Existing noise ordinances prevent late night noises and disturbances as already in place. Thank you for your time and your support of this bill.
Thank you. At this time, we're going to go back to number 2 on my list, Ms. Tamara Furlong Whitfield. Have you joined the meeting at this time?
Yes, ma'am. Can you hear me?
We
I
can.
apologize.
Thank
Technology.
you. No
Thank
problem.
you so much.
State your name and address for the record, and you have 2 minutes.
Tamara Furlong Whitfield, and I am at 670 Swan Drive in Deal, down here in Maryland. And I just want to go on record to say that I support 6920 to help in preserving the farm and the farming industry. And I believe that it's crucial to our future generations to keep farming going and to educate and for ethical cropping and farming, and bringing people out here to us would also support local businesses as well, where we otherwise do not have that resource outside of Southern Maryland. That's all. Thank you. Thank you for your support.
Thank you. Thank you for joining us this evening. With that, the public hearing on Bill number 6920 as amended is now closed. Madam Secretary, please read the title of Bill 6920 as amended.
Bill 6920, an ordinance concerning zoning, farm or agricultural heritage sites, stays, and special events.
Thank you. Is there any further discussion? Ms. Hare?
I have an amendment, but that's all I'm waiting for.
Oh, I don't see any other discussion, so you have the floor.
Well, I think Ms. Hare is waiting for us to do her amendment.
Oh, right. Madam Secretary, please read amendment number 5.
Amendment number 5. This amendment allows a farm or agricultural heritage site stay as a conditional use in RA, RLD, and R1 residential districts, adds the conditional use requirements for a farm or agricultural heritage site stay, and removes all proposed language to allow a farm or agricultural heritage site stay as a special exception.
Is there a motion to adopt?
Mayor, so moved.
Is there a second?
Councilman Persky, second.
Is there any discussion on the amendment?
I can give a little bit of background, Madam Chair.
Go for it.
Okay, thank you. Jessica Hare, District 7. There's a lot of words in that amendment, but I'm going to just try and give a quick background about what the amendment does and then sort of how I got where I got and why I'd like to have your support on this tonight. The amendment does 4 basic things. The first is, as the title says, it switches the farm stays from a special exception to conditional use in those districts. And then it adds 3 sort of specific conditions that goes along with it. And the first one, which is probably the biggest one, is it dramatically reduces the number of people you can have in a farm stay. The current bill allows up to 5 groups of 10 people each or 50 people, which I know I had heard a lot of concerns about in the community as a really large number of people at any one time. So this amendment creates a tiered system. You have a minimum of 10 acres for the farm stays. If you have more than 10 acres but fewer than 50 acres, you may have 3 groups or 12 people at the farm stay at any one time. The reason for that number is to create a little bit of parity with the bed and breakfast homes, which allow 3 rooms, and which, by the way, are conditional use in our code. So that's where I pulled that 3 groups and 12 people. I'm guessing from a bed and breakfast standpoint, you probably can have 4 people in 1 room. So that's how I got to that 12 people number. The second tier would be if you have more than 50 acres, you could have 5 groups or 20 people, whichever is fewer. And so again, larger acreage, up to 5 groups at one time, but we're still reducing that number from the 50 people to 20 people. The second condition that it puts on is a 100-foot setback from the lot line for any improvements related to the farm stays, and that is to give some parity with the farm brewery, farm winery, alcohol production setbacks that we have currently in the code, trying to match all of this to sort of be consistent. The third condition that it puts on is a screening requirement, much like we have under the special events section of the bill, so that you're shielding your neighbors and making sure they are not having any adverse effects from light, noise, those type of offenses. So the reason I got to where I explained a little bit about the bed and breakfast homes, but as you've heard tonight, the farmers would like this to be conditional use. Special exception is an arduous process. It's long, it can be expensive. On the flip side, neighbors are concerned about public participation and the number of people who might be coming at any one time. So I wanted to make sure we're sort of walking that tightrope of balancing neighbors' concerns with the farmers being able to appropriately use their land. I do want to point out that in terms of the uses under this bill, I believe the farm stays are the less intense use. The special exceptions, I think, are going to be the more intense use. If you talk about the farm stays, we heard tonight from one of our guests testifying, this is supposed to be an intimate, small, relaxing stay on a farm. This is not supposed to be, it's not going to be, large scale anything. And while we are allowing a certain number of groups and a certain number of days, there's also state code that comes into play, and Ms. Kenny could correct me if I'm wrong, but I had emailed her about this in advance. COMAR regulations for campgrounds kick in when there's any kind of camping, and camping is defined under the COMAR as any 5 or more days per year for 5 or more persons at a time. So even though we're allowing more than that, anyone who comes in for more than 5 days at a time with a farm stay that could allow 5 people or more, they're going to have to meet all of the restrictions in place for campgrounds under the COMAR. That's licensing, that's bathroom, that's potable water. There's all sorts of other hoops that these farmers are going to have to jump through for the farm stays. So I really think that this amendment strikes that balance where we're allowing the farmers to earn a little bit of extra income, but we're doing it in a way that we're not going to be adversely affecting their neighbors based on the conditions that we're putting in the bill. And so with that, I'm happy to answer any other questions, but I'd ask for your support on this amendment.
Are there any questions regarding this amendment? Would the administration like to weigh in?
Thank you, Madam Chair. Pete Barron with the administration. Yeah, I'll add a few quick points. I think we've heard a lot of discussion. I think it's important to remember that under current law, this would be allowed, and we're not seeing a ton of people take advantage of this. The couple of farms that are interested in it, the administration believes this will help them continue as farms. They will still have to be farms. So let me just say that one last time. The administration is comfortable with the bill as it exists. It passed the Ag Tourism Commission unanimously. Frankly, we believe the bill is workable with or without this amendment. The designation of site stays as conditional and the additional conditions the sponsor of the amendment or the maker of the amendment puts on, or leaving the bill as special exception is workable. We believe that either will allow a couple of farmers to take advantage of a new line for their business. And we would leave this to a policy decision for the council as to whether or not conditional or special exception is the right way to go. I think there's good arguments on the special exception side. You allow a public participation process, but you have a cost associated with it for the farm. Designating it as conditional removes that, but now has additional conditions put on it. So I think what the sponsor's done is try to balance these competing concerns, and the administration is comfortable with whichever way the council decides to take on this policy.
Are there any questions for either the sponsor or the administration regarding amendment number 5? Seeing none. Madam Secretary, please call the roll on amendment number 5.
Ms. Hare?
Aye.
Ms. Lacy?
Nay.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
6 in the affirmative, 1 in the negative. Amendment number 5 is adopted.
Bill number 6920 as amended will be heard again on November 2nd, 2020. Madam Secretary, please read the title of Bill number 72-20 as amended.
Bill number 7220, an ordinance concerning licenses and registrations, unattended donation boxes.
Mr. Volkey, this is your bill. You have the floor.
Thank you, Madam Chair. Nathan Volkey, District 3. Before I talk too much about this bill, I'd like to show a couple of pictures because I think they will highlight the issue even better than what I can say. So, Ms. Corby, if those are ready, if we can share those few pictures. So the first picture that you see here is one that I took of one of these collection boxes in my area. And as you can see, there is a bunch of debris in front of it. This is another picture, what you're seeing on the screen now, which was taken by an individual who submitted a letter to the editor of our local paper. And then this last one, again, is another picture of that overflow on a different date at the same location as the first picture. So, Ms. Corby, if you can just go to the picture and hang there, that's the letter to the editor picture. I just want to talk about that for a second. So this issue came to my attention a little over a year ago when a constituent repeatedly was asking me to see if there was anything we could do to help with these overflowing collection bins. You may have a little trouble seeing it, but hopefully you can see there are bags and bags and bags of stuff that are in front of these collection bins just sitting there. And the concern with this is these are really big, really heavy collection bins, and they are ubiquitous. They're all over the county. We don't know, we being the county government, where any of these things are. They're placed on private property, but sometimes they're not. And that's where the issue really comes in. We have had situations where these boxes have caught on fire. We have had situations where these boxes have been left on abandoned property. We have situations where these boxes have been left on property that's in foreclosure. And so we don't know who to contact in terms of the owner. So it's really become an issue because they're a blight and eyesore for the community. What I'm trying to do with this bill, Ms. Corby, we can close off the pictures now. Thank you very much. I just sent those to her at the last minute, so I'm very grateful that she was able to find a way to put those up. But I do think those pictures sort of paint the story even more clearly than anything that I can say to you. Ultimately, these boxes are a good thing in many respects. They allow charitable donations to get from people who have to people who are in need. That's what we want to encourage. We want to see more of that. There is no intent with this bill to penalize people. The intent, however, is to find out who owns the boxes, find out where they are, and make sure that the county understands if there's a problem in a particular location, that we have someone we can contact to go out there and try to remediate the problem. If they do not remediate the problem, then we are able to levy fines. There is a registration component to this bill. It is free for any nonprofit entity. If you are a for-profit entity that is operating one of these boxes, you would have a $40 fee that you would have to pay every other year. I think that's a reasonable compromise to ensure that the Office of Inspections and Permits, who is going out and ensuring compliance on a complaint-driven basis, is able to do their job without costing the taxpayers additional funds for the work that needs to be done. So with that, I would ask that my colleagues support this. I thank you for passing the amendments at the last meeting that I believe strengthen this bill. I'm hopeful that I can get your support, and I look forward to hearing from the administration and others. Thank you.
Mr. Pruski.
Thank you, Madam Chair. Councilman Andrew Pruski. Thank you to the sponsor and the administration for the amendments. I had some grave concerns when this first came out, but I do have a question. This is a request. It's not in the legislation, but I'm going to ask. Is it possible for INP to send a report to the council on the status of this when it's initiated through this first year? And the reason why I ask that is because if we have unintended consequences where either donations have gone down or it's become too burdensome, we would revisit this bill. I'm sure the sponsor would like that as well if it's passed. But is it possible for INP, if we put that request in, to kind of update the council, how many cases, how many issues, concerns? I just asked that as part of the public record, if I would. Thank you.
Mr. Barron, and you can also use this time to respond.
Thank you, Madam Chair. Pete Barron, I now have a flag. First, Councilman Pruski, I don't think we will be able to give you data on the quantity of donations. There's a number of various companies that do this, and as the sponsor mentioned, some are nonprofit and some are for-profit. I'll defer to Mr. Africa, but we will keep track of the complaints that we get, and if we have to go out. So I'm sure that wouldn't be outside of anything that we could do, but I'll make sure with Mr. Africa, since it's his team that will actually have to do the work.
Yes, Greg Africa, Director of Inspections and Permits. I would echo what Mr. Barron mentioned. We have no mechanism to track the number of donations by tonnage or any other measure, but we will certainly be able to track any kind of complaints and the location of the complaints.
Madam Chair, if I may, Councilman Andrew Pruski.
Proceed.
Thank you. I'd appreciate that. Again, I understand, we're not in the business of trying what the private donations are, but if there are, overly too many complaints or too little, it would just be nice to know. And if we could do that in an annual basis, just mark it on the calendar. You can put it in Google right now. Send the council memo, and I'd appreciate that. But thank you.
Madam Chair. Oh, sorry.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. If Mr. Barron had something he wanted to add to that train of thought, I was going to move on to a different line of questions.
Sorry, Madam Chair.
Mr. Barron.
Pete Barron with the administration. I was actually just going to respond sort of generally to the bill as amended. Happy to answer your questions first or go with the two comments I was going to make about this bill, whatever the council prefers.
You have the floor, so just proceed.
Thank you, Madam Chair. Pete Barron with the administration. We already heard from Mr. Africa from INP, and Ms. Kelly from the Office of Law has joined us. I want to thank Ms. Kelly, or Ms. Kelly Kenny, sorry, Kelly, and Ms. Schuett and everybody that put in several hours to get this bill to where it needed to be. As Councilman Folke introduced it, we raised a number of concerns working with Councilman Folke and Legislative Council and Office of Law and IMP experts. I think we crafted a very good bill. For comparison, and I believe this was mentioned at the hearing last time, we looked at a Baltimore County bill that was something like 30 pages. We're much more efficient here in Anne Arundel, so we brought it down a little bit. It's a very understandable bill. We think it's going to make a difference because even before Councilman Volke showed those pictures, everybody has driven past some of these. We see them all the time, and we need to balance the ability to get these donations with the problem of dumping and blight that they can cause when they are untended. So with that, happy to answer any further questions, but the administration supports the bill as amended.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. I'm not sure who could answer this question, but I'm hoping someone has. This might be Mr. Africa's territory, but I'm envisioning a scenario where you indeed have, a piece of abandoned property or, for whatever reason, the business there is closed and no one is, taking care of the property. And whatever entity has dropped off their drop box on said property, if they have not registered with the county, how do you go about tracking them down? Is there a way? I mean, usually they have the name of some company, but some of them are, nationwide companies or nationwide entities that are collecting these donations. So what would be the process for finding the responsible party if they had not registered with the county and they just kind of stuck their box on what appeared to be an empty lot?
Mr. Barron.
I'm going to ask Mr. Africa to weigh in, but Ms. Kenny might also have some things to say about the enforcement of this.
Greg Africa, Director, Inspections and Permits. Well, our first attempt would be to look at the property records and try to figure out who can be in, who we can get in touch with, since the registration process involves both the operator and the property owner. So that's going to be our first step, and we'll take it from there.
Does that answer your question, Ms. Radbian?
If there's any more detail about where you would go that, and anyone else would like to share, but if that's, as far as you can predict, I will accept that answer.
If I may add to that, Mr. Chair.
Kenny, sure.
Kelly Kenny, Supervising County Attorney, just to elaborate on what Mr. Africa said. The property owner is always responsible for any violations that are on their property. So if INP could not locate the owner of the unattended donation box, they could always proceed civilly against the owner of the real property. So that's always a method of enforcement as well.
Do we have any other questions regarding Bill 72-20 as amended? Seeing none, we will now open the public hearing on Bill number 72-20 as amended. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we had one submission of written testimony on Bill 72-20, which was shared with the council and posted on the council website.
Thank you. We will now hear from members of the public who signed up ahead of time. We have one person signed up to speak on this bill. Remarks will be limited to 2 minutes. When it is your turn, please unmute yourself and begin by stating your name and address for the record. I have Ms. Donna Hergen-Roeder. Is Ms. Hergen-Roeder with us this evening?
Yes, I'm with you.
How did I pronounce your name?
Great.
Did I do the job? Oh, good.
Thank you, Madam Chair. Good evening, and thank you, Councilman Volke, for introducing this bill regarding unattended donation boxes so owners are accountable. So please accept this testimony in favor of Bill 72-20. Donation bins are notoriously hard to monitor. Attended ones, unattended ones, and the many which are owned by overseas operators. Unattended boxes are left alone on public-facing properties, and as you all have mentioned, and the pictures show, and I have many pictures, they have become a dumping ground, not only here, but around the country. And multiple items besides clothing and shoes for which they were attended are conveniently dropped off. So owners need to be identified to pick up the trash and items that are too large. And on a weekly basis, I can give you an example. At unattended bins particularly, there are mattresses, couches, TVs, computers, trash, garbage, household goods, you name it, and many other things happen as a result. A survey last week ranked the one near me, the unattended bins at Fort Smallwood and Bar Harbor Road, as number 1 of 6 local area bins for the number of dumped items and trash. The other ones I will note were on attended business properties. And as you stated, other counties and municipalities around the country are addressing this growing problem. Being responsible to collect trash in public areas goes a long way to improving communities. As I mentioned in my research, trash begets trash, gets into the Chesapeake, and even increases criminal activities and it does affect mental health. And I did submit all that research separately. So pending your questions, that's all I have.
Thank you.
Madam Chair, if Ms. Hergenroeder could please state her address for the record.
Oh, I'm on Bar Harbor Road in Pasadena.
Thank you.
Thank you. With that, the public hearing on Bill number 72-20 as amended is now closed. Madam Secretary, please read the title of Bill number 72-20 as amended.
Bill 7220, an ordinance concerning licenses and registrations, unattended donation boxes.
Is there any further discussion? Seeing none, Madam Secretary, please call the roll on Bill number 72-20 as amended.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Bill 7220 is passed.
Thank you. Madam Secretary, please read the title of Bill number 75-20.
Bill number 7520, an ordinance concerning conveyance of surplus property, unimproved county-owned property near Furnace Branch Road in Glen Burnie, Maryland.
Thank you. This is an administration bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. Pete Barron with the administration. Joining me from Central Services is Ms. Harris and Mr. Walker. From Law, Ms. Niederer. Bill 7520 is sort of similar to the bill, the resolution we heard earlier. Bill 50-20 was the conveyance of the same property that the administration had to withdraw for a technical failing on our end. We apologize for that error. Bill 7520 is done under the proper rules under the code. This property is located in Glen Burnie, Maryland in District 2. It's at the corner of Furnace Branch and Crane Highway. The property was offered to bid in accordance with Article 8, Section 204 for 3 consecutive weeks on August 15th, 2020 through August 29th, 2020 with a minimum bid of $103,000. Reliable Real Estate Services LLC submitted a bid in the amount of $105,000 on October 24, 2020 in accordance with Article 8, Section 204F. An ordinance is required for the sale of property for which the purchase price is less than 90% of its appraised value or is appraised at $50,000 or more. This is a case of the latter. The council has been provided a map of the surrounding area as part of the legislative package. If the council approves, the real estate team will proceed with disposing of this property in accordance with the county code. If members of the council have any questions, the experts on the panel or myself are happy to answer. With that, we hope you move the bill today.
Thank you. Are there any questions from the council regarding Bill 75-20? Seeing none, we will now open the public hearing on Bill number 75-20. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we've received no submissions of written testimony on Bills 75-20.
Thank you. We do not have any members of the public signed up to speak. Therefore, the public hearing on Bill number 75-20 is now closed. Madam Secretary, please read the title of Bill number 75-20.
Bill number 7520, an ordinance concerning conveyance of surplus property, unimproved county-owned property near Furnace Branch Road in Glen Burnie, Maryland.
Is there any further discussion? Seeing none, Madam Secretary, please call the roll on bill number 75-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Bill 75-20 is passed.
Thank you. Okay. Madam Secretary, please read the title of bill number 76-20.
Bill number 76-20, an ordinance concerning subdivision and development, adequate public school facilities, school utilization chart.
This is an administration bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. Pete Barron with the administration. Joining me is our Office of Planning and Zoning Director, Mr. Kai Ziegler, from Anne Arundel County Public Schools, Mr. Shaknovich, and from Law, Ms. Blair Klausmeyer. We've seen a couple of these bills in the past. Bill 76-20 fulfills the requirement in section 17-5-502 that requires the planning and zoning officer to prepare an annual school utilization chart and submit it to the county council for approval. This chart is used to evaluate development applications for compliance with adequacy of facility regulations as it relates to school capacity. The chart is based on enrollment projected by the Board of Education in the most recent Educational Facilities Master Plan prepared by the Board of Education, as well as new students generated by new development approved by the Office of Planning and Zoning since the last school utilization chart was approved or updated. One thing to note that's different in this version of the chart than previous versions of the chart, we have added a decimal point to give the council and the public a little more clarity on where schools are as it relates to the capacity requirements. So with that, the folks here are happy to answer any questions, and we ask you move the bill. Thank you.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. I appreciate the additional clarity that the administration has added to this year's school utilization chart. I continue to not be a fan of the way that we do these charts. Mr. Shaknovich and I have had a number of discussions about some possible legislation that I wanted to put forth that would have changed the way that we do the school utilization chart to make the numbers more reflective of what's going on today. Because for the benefit of my colleagues, just to give you a brief overview of how I understand this to work, and I know I'll get a correction if I get it wrong, it sounds to me like in a given year, let's say this year, for instance, by September the 30th, the local school board has to send to the state school board their count of their students. Usually within about a month after that, by early November, generally November 1st, the State Board of Education certifies that Anne Arundel County's count is correct. What they do is dedupe students. So they make sure that Anne Arundel and Howard aren't counting the same student twice. For instance, if you had a child who had moved or something like that, it could trigger. After that, it then goes through a series of reviews where it goes back to the local board. They work on some figures. Then Mr. Shaknovich, I'm going to mess this up, but it just goes through a long period of review that ultimately brings us to about this point where we get the chart with the numbers, which is usually in October to November of the year after. So we're always running about 12 months behind. And my concern with that is I just don't like making decisions on data that old. So I don't have any problems with the chart per se, because I think the way that you all have done it is the way the statute requires, but I continue to dislike the way that we do it. I think that the information is just stale, frankly, when we get to 12 months out, and I'd like to see us change that. I'm hopeful that by me making us think about this a little bit, that it'll keep it on the radar, because I know that Mr. Kai Ziegler and his team and a number of other people on the schools portion of the Adequate Public Facilities Work Group are working on this issue, and I believe they will be coming in hopefully with some legislation. That's part of why I put mine on the side track, so that we can see what comes out of the work group. But I am hopeful that we can address this because I really do think this is an issue in terms of using old data to make today's decisions. So with that, I just wanted to explain my reasons for why I'm voting no. But I appreciate all the work that's been put into this by the administration, by the school board, by the Office of Planning and Zoning, by so many people. And I look forward to hopefully correcting this issue in the future. Thank you.
Are there any questions or comments from my colleagues regarding Bill 76-20? Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. I would like to echo my colleagues' sentiments. I am also frustrated with how we are on a delayed schedule with these numbers when real-time numbers in schools tend to be drastically different in some cases. I will, however, be supporting this bill this evening. There are 2 schools in the 5th District that are closing, and I know that community members have been feeling that the overcapacity for some time. So I thank Mr. Shaknovich and the Office of Planning and Zoning for working on this.
Ms. Lacey.
Thank you, Madam Chair. Sarah Lacey, District 1. I just want to comment for the record and for my colleagues' benefit. I think these 2 charts aren't helpful to our decision making to actually moving forward with the larger conversation that we need to be having about redistricting. The chart shows large inequities in the distribution of students throughout our school system, but to realize that, you have to do the work of reading the 2 tables together, which doesn't allow for people to just see it when they otherwise would be able to. We don't need to be hiding the ball. We need to be talking about redistricting. And the only reason I'm voting for this bill is because I feel like it's an administrative perfunctory thing that we need to do, but we have absolutely no input into the redistricting. We don't have anything to do with reviewing this chart. I think it's a pointless exercise until we can talk about fixing these inequities, because I know I'm tired, my constituents are tired of seeing those 108, 120 huge overcapacity numbers when we know we have other schools with lower capacity and we're not even having the conversation. Maybe COVID and hybrid schooling, virtual school can be a great jumping point for us to actually move this discussion forward. But until then, I'd rather abstain, but I don't think that's my job. I'm going to vote for it.
Thank you. This is Allison Pickard, Chair, District 2. And just for the record, I have had a couple conversations both with the administration and with planning and zoning regarding bringing the 2 charts together so that we can see more clearly how percentages and state rated capacity is in each feeder, not just in an alphabetical list of schools. The data doesn't change, but the story changes when we're looking at a chart that shows, there might be one elementary school that's at 108% occupancy, but the remainder of the elementary schools in that feeder are well below 90 or 85%. It certainly shows the public how we have a redistricting opportunity before we have a need to add additions to schools with capital dollars or even build additional schools. So I think that's a simple thing to do. The next time we see a school chart is to collate the 2 charts into one, and we can see the data tell a different story. So is there any other questions or comments regarding Bill number 76-20? Mr. Barron.
Pete Barron with the administration, just going to say, Madam Chair, message received.
We good? We'll now open the public hearing on Bill 76-20. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we received 1 submission of written testimony, which was shared with the council and posted on the county website.
Thank you. We did not have any members of the public sign up to speak. Therefore, the public hearing on Bill number 76-20 is now closed. Madam Secretary, please read the title of Bill number 76-20.
Bill number 7620, an ordinance concerning subdivision and development, adequate public school facilities, school utilization chart.
Is there any further discussion at this time? Seeing none, Madam Secretary, please call the roll on Bill number 76-20.
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Nay.
I'm sorry, Mr. Volkey?
Nay.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Radvian?
Aye.
Ms. Pickard?
Aye.
6 in the affirmative, 1 in the negative. Bill 7620 is passed.
Madam Secretary, please read the title of Bill. Oh, Bill number 77-20.
Bill number 7720, an ordinance concerning planning and development master plan for water supply and sewerage system.
Thank you. This is a county executive bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. Pete Barron with the administration. Joining me at the table from Office of Planning and Zoning is Ms. Carrier, and from Law, Ms. Kenny. But that wasn't me. Bill 7720 allows for properties to connect to public sewer within the Cox Creek sewer service area instead of the Broad Neck sewer service area. All of the parcels are currently in the planned sewer service category. This change in service area boundary was reviewed and supported by the Office of Planning and Zoning, the Department of Public Works, the Department of Inspections and Permits, and the Health Department. Do want to note that we will be asking for an amendment at the appropriate time to clarify and make some corrections to parcel numbers.
Thank you. Are there any questions of my colleagues regarding Bill number 77-20? Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. This question, I believe, is for Ms. Kenny. On that particular road, there are only a handful of parcels that are not connected to public utilities. Is that correct?
I believe that's probably a question for Ms. Carrier. I do not know the answer to that.
My apologies.
That is correct within that service area.
Thank you.
Are there any other questions for the administration regarding Bill number 77-20? Seeing none, Madam Secretary, do we have, we will now open the public hearing on Bill number 77-20. Madam Secretary, did we receive any testimony from the public?
No, Madam Chair, we received no submissions of written testimony on 7720.
And we did not have anyone sign up to speak. Therefore, the public hearing on Bill number 77-20 is now closed. Madam Secretary, please read the title of Bill number 77-20.
Bill number 7720, an ordinance concerning planning and development, master plan for water supply and sewerage systems.
Is there any further discussion? Seeing none, there is an amendment. Madam Secretary, please read amendment number 1.
Amendment number 1. This amendment clarifies that certain parcels are being moved from the Broadneck Sewer Service Area into the Cox Creek Sewer Service Area, corrects a parcel number that is being added to the Cox Creek Sewer Service Area, and removes Exhibit 1 and replaces it with Exhibit 1A to match the correction.
Is there a motion to adopt?
Councilman Pruski, motion to adopt.
Is there a second?
Fair, second.
Is there any discussion? Mr. Barron, did you want to discuss this amendment?
Thank you, Madam Chair. Pete Barron with the administration. Happy to. Amendment 1 clarifies that certain parcels are being moved from the Broadneck Sewer Service Area and into the Cox Creek Sewer Service Area, corrects a parcel number that is being added to the Cox Creek Sewer Service Area, and removes Exhibit 1 and replaces it with Exhibit 1A to match the correction. Does not change the scope of the bill. It just clarifies and corrects some technical portions of it. With that, we ask the council to move the amendment.
Is there any questions regarding the amendment? Seeing none, Madam Secretary, please call the roll on amendment number 1.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Radvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Amendment number 1 is adopted.
Thank you, Madam Secretary. Bill number 77-20 as amended will be heard on November 2nd, 2020. Madam Secretary, please read the title of Bill number 78-20.
Bill number 7820, an ordinance concerning subdivision and development, fees and security, use of development impact fees.
This is an administration bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. I have a distinguished panel joining me this evening. Our Deputy Chief Administrative Officer for Land Use, Ms. Laurie Rhodes, our Planning and Zoning Director, Mr. Stephen Kai Ziegler, from Budget, Mr. Stephen Teru, from Law, Ms. Lori Blair Klausmeyer, and our County Attorney, Mr. Greg Swain. So Bill 7820, it deals with development impact fees. Development impact fees are charges paid by the proposed developer to fund the cost of improving real property that serves the development, thereby causing an impact on schools, transportation, or public safety. The purpose of 7820 is to allow development impact fees to be used to pay for the studies and analyses of the fees periodically, which is required to ensure the county fee schedule is equitable and not solely for capital improvements for expansion of capacity of the various public facilities, schools, roads, public safety, what have you. And this is set forth under section 1711-209 of the code. With that, the purpose of this bill is really to shift the cost of doing the studies off of the regular resident taxpayer and onto the developer. In the budget this council approved in whenever that was, in June of this year, there was $200,000 to fund a study out of general funds. This bill would allow us to use funds in the impact fee account to fund such a study. So with that, we're happy to answer any questions and ask that you move the bill.
Are there any questions of my colleagues regarding Bill 78-20? Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. I am curious what the Office of Law makes of some of the concerns that this may not be legal. I know that there have been some back and forth, I think email trafficking or memos, but I just want to understand from the Office of Law, is it your position that we can do this, that it is legal for us to use impact fees for this purpose?
Good evening, Greg Swain, County Attorney. At the request of Legislative Counsel Linda Schuett, we did do an opinion on this issue. The state enabling legislation for the county's impact fees is fairly short. It simply grants the county the legal authority to fix, impose, and collect development impact fees for the purposes of expanding public facilities. The analysis that we undertook when we looked at this was the scope of that grant of authority. And what our conclusion is that the scope of authority granted, it really falls into two categories. There's an express authority, which you can gather by reading the actual language of the statute. And then there is also an implied grant of authority for those items that are necessary to implement what the statute authorizes. So our conclusion was based on that principle of implied authority, based on the language of the statute that gives the county the authority to fix and impose impact fees. Our conclusion is that that does carry with it an implied authority to pay for these fee studies. And it's an important point that these impact fee rate studies are a necessary component of any impact fee program, because as the case law has developed regarding impact fees, there is a requirement that the impact fees actually have a nexus to what they're being, to why they're being charged and to what they're being spent for. So you really can't have an impact fee program unless you do the rate study to verify the amount of the impact fees that you're being charged. So based on that, based on the fact that the rate fee study is a necessary component of an impact fee program, it's our conclusion that the state enabling legislation carries with it an implied authority to both make those studies and pay for those studies. Now, I know from previous discussions with Mr. Kai Ziegler and his experience in other jurisdictions that there are a number of jurisdictions that use impact fees to pay for these impact fee studies. They have not codified that authority. So when you look at their local county codes, it has not been codified. They simply do it based on the language of their, just the broad language of their own local ordinances. So we felt that because the way our impact fee ordinance is written, that this was not permitted, but we did feel that it was permitted under the enabling authority. And that's the purpose behind Bill 7820.
Madam Chair.
Mr. Volkey.
Thank you. If I may follow up, Nathan Volkey, District 3. Mr. Swain, I appreciate that. And I did have a chance to read that opinion. So I guess my question would be this: has the law changed in the last few years since we did the last impact fee study? I'll just leave it there for the first question. Has there been some major new case, or has some major new case come down? Has there been a big development that's changed the law that's now leading us to reconsider our position on how we fund these impact fee studies?
Well, there's not been, there's very little case law on impact fees. And probably the biggest case in the last decade or so was the case involving Anne Arundel County, which was the Dabbs case, where the court made it pretty clear that the scope and the operation of these impact fee programs is really left mostly to the county if they have enabling legislation to have an impact fee program. So I think the, and Mr. Kai Ziegler may be able to answer this better than I, but I think the idea to fund these studies from the impact fees themselves is really driven by two things. Number one, as I've already said, that these are a necessary component of the impact fee program. But number two is that we should be doing these studies more than we do. I think the last one we did was more than 10 years ago, and our code has language that we should be doing these every 4 years. So I think that's in part why there's not been, it's not that there's been a change of a law that allows this. It's that this has just not been an idea that's been pursued in the past. And I think part of that impetus for this coming through is Mr. Kai Ziegler's experience in other jurisdictions where this is the case.
Madam Chair, if I may.
I see Mr. Kai Ziegler has his hand up, and then I'll let you. You have something to add, Mr. Kai Ziegler?
I do. Good evening, Steve Kai Ziegler, Planning and Zoning Officer. Mr. Swain's absolutely correct. Keep in mind that Anne Arundel County has not studied or comprehensively updated its impact fee program since 2009. When I came into employment with the county in July of last year, as I started to look at our major programs, assets, the way we did the work that we do, it was recognized that it was time to update that impact fee program. And I operated on the premise, based on my previous experience in several other counties, that we could use existing impact fees collected to pay for the necessary studies. And this would have been the discussions with the Office of Law, and the administration would have been about this time last fall into the budget cycle. I was a bit surprised when I in double checking with the Office of Law's, I'm going to say informal opinion was that we did not have specific language in the code that would allow these impact fees collected to be used for study purposes. And so what we essentially decided to do was pursue requesting enough money in the budget to pay for the impact fee study update, but also to pursue legislation to, I'm going to say, make it very specific that in Anne Arundel County, we could do what we had done in the other jurisdictions I had worked in. So I hope that explains some of the, I'm going to say, recent time periods. So if there's kind of someone that to blame as to why this has come up in the last year, it's probably my fault.
Thank you. At this time, we're at our 90-minute mark for our transcriptionist. We need to take a 10-minute recess. May I have a motion to recess for 10 minutes? Coming back at 9:15.
Lacey, so moved.
May I have a second?
Godbian, second.
All in favor? Aye.
Aye.
Opposed? The motion carries. We will return at 9:15. Thank you. Oh. Yes, ma'am.
I usually call the roll, but that's okay.
Oh, no. Okay.
Madam Chair, I am here.
Oh, thank you. I was looking for you. Madam Secretary, please
There
call
we
the
are.
roll.
Yes, now is when I call the roll. Ms. Hare,
Present.
Ms. Lacy,
Present.
Mr. Volkey,
Present.
Mr. Pruski,
Here.
Ms. Fiedler,
Present.
Ms. Rodvian,
Present.
Ms. Pickard.
Present.
Madam Chairman, all council members are present.
Okay, thank you. And with that, we will continue. Are there any further questions regarding Bill 78-20? Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3, picking up where I left off. So what I was trying to understand, I guess, and I think Mr. Kai Ziegler alluded to this, is it seems like since 1986, Anne Arundel County has had the authority from the state to be able to set impact fees. Am I understanding that correctly, Mr. Swain? I think you're muted.
Mr. Swain.
Oh, still muted.
That's correct, since 1986. So
Okay.
the state passed the enabling legislation. I think the county enacted its program 86, 87. So.
Okay, perfect. And so since that time, I think what we've done, Mr. Swain, you may know this because you have institutional knowledge, is what I'll say, of Anne Arundel County. We've always paid for these out of the general funds with an understanding that the impact fees that we collect are to be directly used to offset the impacts of development. Is that what the traditional policy has been in Anne Arundel County?
As far as I know, we have never used impact fees to pay for the impact fee rate studies.
Okay, it's always been directly to do toward projects that would mitigate the impact of development. Is that the nexus between the fees and the uses?
That's correct. The fees are, we have impact fee districts, and the fees are spent in those districts for expanding public facilities, right?
Okay, perfect. So I guess that's where my struggle with this bill comes in. I don't understand, since 1986, we've done it this way. This has always been the intent. And now all of a sudden, we've decided we're going to change this up and do it differently, especially on the heels of the last budget, which we passed a few months ago, where we funded the first impact fee study out of the general fund that we've seen in, according to the number I heard earlier, since 2009. So I'm not clear on why we need this going forward, or why we should be taking money out of the impact fee districts to use for a study. It seems like it's sort of taking money from its intended purpose for something else. That's the way I see it. And others may view it differently. I understand the Office of Law sees it differently, but that's the way I see it, which is why I'm going to vote no on this bill.
Are there any questions of my colleagues on Bill 78-20? Seeing none, we will now open the public hearing. Madam Secretary, do we have any testimony received from members of the public on Bill 78-20?
No, Madam Chair, we've received no submissions of written testimony on Bill 78-20.
And we did not have any members of the public sign up to speak. Therefore, the public hearing on Bill number 78-20 is now closed. Madam Secretary, please read the title of Bill number 78-20.
Bill number 78-20, an ordinance concerning subdivision and development, fees and security, use of development impact fee funds.
Is there any further discussion? Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I too am hung up after Mr. Swain said for the purpose of expanding facilities is what the impact fees are supposed to be utilized for. And I just don't, I'm not making the connection that paying for a study to evaluate the appropriateness of the fees is actually expanding facilities. So for that reason, I will not be supporting this bill tonight.
Is there any further comments or questions? Madam Secretary, please call the roll on Bill number 78-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Nay.
Mr. Pruski?
Aye.
Ms. Fiedler?
Nay.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
5 in the affirmative, 2 in the negative. Bill number 7820 is passed.
Madam Secretary, please read the title of Bill number 79-20.
Bill 7920, an ordinance concerning public works, utilities, extension of public water and wastewater systems.
This is an administration bill as well as co-sponsored by Ms. Hare. Mr. Barron, you have the floor.
Thank you, Madam Chair. Pete Barron with the administration. Joining me is our Environmental Policy Director, Mr. Johnston. From Department of Public Works, our Director, Mr. Phipps, Ms. Henry, and Mr. Heiner. From Office of Law, Ms. Kenny. Bill 7920 eases the bureaucratic burden of a property owner's experience when petitioning the county to connect to public water and sewer. The county created a septic task force, which was composed of citizens, to recommend ways to simplify and streamline the petition process in hope of making more petitions successful. These changes are the changes proposed in Bill 7920 are a result of the recommendations provided by the task force. Just a quick summary. Major changes include allowing DPW to assist the property owners with reconfiguring the petition area without the requirement to start the process over from the beginning. Simplify the process for the community to accept the self-sustaining rate by allowing petitioners to vote for the assessment rate in a ballot submitted to DPW, eliminating the need for the rate to be approved by the county council should it exceed the minimum basic rate. Simplifying the process for the county and the petitioner's approval of the assessment rate. It strengthens the consequences for making illegal connections to water and sewer by making that a Class C offense. And the bill more clearly defines an abandoned project. I want to take a moment to thank everybody involved with the septic task force. There's been a couple of septic bills that we have seen. The folks, not just on the folks on the Brady Bunch screen right now who helped with this, but there's a bunch of folks in county government who have lent expertise to this. There's a bunch of citizens who have lent expertise to this. And I also want to give a thank you to Councilwoman Hare, who is co-sponsoring the bill and who has been actively involved in septic issues for a while now. So thank you, Councilwoman Hare. Thank you to everybody who helped participate and is helping participate in the septic task force. So thank you. And we are happy to answer any questions. We ask that you move this important bill tonight.
Thank you. As co-sponsor, Ms. Hare, did you want to add anything?
Sure. Jessica Hare, District 7. I'll just say, I think Mr. Barron covered most of it. The current process for petitions is very rigid in the county. Mr. Phipps and I had a number of conversations about this. The Septic Task Force did discuss it a lot. This bill is aimed at making the process collaborative in the hopes that we see more successful petitions moving forward. So that's all I'll say. I'm excited for this. I'm hoping that it's going to make a difference in a number of petition projects that haven't been able to get off the ground in the past to help them come to fruition now.
Are there any questions of my colleagues regarding Bill 79-20? Seeing none, we will now open the public hearing on Bill 79-20. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we have received no submissions of written testimony on Bill 7920.
And we did not have any members of the public sign up to speak. Therefore, the public hearing on Bill number 79-20 is now closed. Madam Secretary, please read the title of Bill number 79-20.
Bill number 7920, an ordinance concerning public works, utilities, extension of public water and wastewater systems.
Last chance for discussion. Seeing none, Madam Secretary, please call the roll on Bill number 79-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Bill 7920 is passed.
Thank you. Madam Secretary, please read the title of Bill number 80-20.
Bill number 8020, an ordinance concerning public works, utilities, assessments, water and wastewater facilities.
Ms. Hare, this is your bill. You have the floor.
Thank you, Madam Chair. Jessica Hare, District 7. So this is what I think is going to be the last septic bill, at least for a bit. And I did such a poor job of explaining this at the work session. I actually, during the recess now, just drew a picture because I think that's the only way that I can describe it. Right now, when there is a petition project and a community files this petition, the way that the assessments are calculated is based on a front footage, literally how much frontage your property has on the road. So this can result in some funny things. So I'm gonna, oh, can I get it? I don't know if you all can see, but essentially I drew two parcels. They're both the same exact size. They're just oriented differently on the road. So the first one has 100 feet of, or I'm sorry, 50 feet of road frontage. And the second one has 100 feet of road frontage. They're both 5,000 square foot lots. They both have the same house on them. The house, the property that has a 100-foot road frontage will pay double what the property that has a 50-foot road frontage on it. So same properties paying wildly different amounts. It doesn't seem equitable. This bill changes the way the properties are assessed so that they are assessed on a dwelling basis as opposed to a front footage. Mr. Phipps can explain all of the more complicated parts, but that's all I'll say about it, and I ask for your support.
Is there any other comments or questions? Mr. Pruski.
Thank you, Ms. Hare. Your diagram definitely makes sense. But I do have a question for Mr. Phipps, and I can't use my attorney one, so I'll say that I'm an engineer and I play Legos with my kids. The whole point is there more cost per capital of running longer pipe? Like, I just want to be clear that, you know, the sponsor's intent makes sense, but I just want to be absolutely clear about the actual charge and the connection. You know, if you're same lot, but it's a narrow lot versus another lot. So if you can explain that, that will help me understand it. Again, it makes sense, but I just want to make sure from your end. Thank you.
Mr. Phipps.
Thank you, Chris Phipps, Director of Public Works. Really, all we're doing is it's the assessment method. So the cost of the project is the same, no matter how we assess it. So we just feel that this is a much more equitable way of assessing the cost for that, serving that community, because what they're purchasing is an EDU, or 250 gallons of capacity in our system. So that's how we arrived at that. And as Councilwoman Hare explained it, it's inequitable if we try to slice and dice it any other way, because really what they're buying is one EDU in our system.
Ms. Hare or Ms. Rodvian, who's first?
I can yield to Ms. Hare. Okay, thank you.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. So my question is basically, at what level does this calculation take place? Is this something that would be per project, like, you know, imagining a new neighborhood that's connecting, or would it be broader than that?
Madam Chair, I'm not sure if that question is for me or Mr. Phipps, but the answer, I believe, is that it's on a petition by petition basis. So if one community petitions to have their their sanitary sewer extension, the calculation is done for that petition only.
Thank you.
Do we have any other questions regarding Bill? Oh, Ms. Fiedler.
This is not a question. I'm still taken aback by the diagram. I think I prefer those more than the DPW ones. My apologies, Mr. Phipps.
The lines were very straight.
Somebody had a ruler. We're good on questions regarding Bill 8020. We will now open the public hearing. Madam Secretary, do we have any testimony received from members of the public regarding Bill 8020?
No, Madam Chair, we've received no submissions of written testimony on Bill 8020.
And we did not have any members of the public sign up to speak this evening. Therefore, the public hearing on Bill number 80-20 is now closed. Madam Secretary, please read the title of Bill number 80-20.
Bill number 8020, an ordinance concerning public works, utilities, assessments, water and wastewater facilities.
Last chance at any discussion. Seeing none, Madam Secretary, please call the roll on Bill number 80-20.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Fiedler.
Aye.
Ms. Rodvian.
Aye.
Ms. Pickard.
Aye.
7 in the affirmative, none in the negative. Bill 8020 is passed.
Madam Secretary, please read the title of Bill 81-20.
Bill number 8120, an ordinance concerning zoning, home occupations, cottage food businesses.
This is Ms. Rodvian's bill. Ms. Rodvian, you have the floor.
Thank you, Madam Chair. So just a little background about this bill. I was approached by a constituent who was suffering some economic distress as a result of the pandemic that we've all been experiencing. And this person decided that they were going to start selling or baking bread for friends. And eventually this bread baking grew into a small business. When this baker decided that he wanted to, make sure that he was doing everything by the books, he went and, started crossing off all the T's and dotting the I's and discovered that it's not currently allowed to have this kind of business as a cottage business under our code. It is allowed under state law. So I thought, well, this is a great opportunity to help an entrepreneur, small business owner. And so I hope this is an easy one to support for all of us. He has the support of his neighbors who probably appreciate the smell of delicious home-baked bread coming from his home, probably on a rather regular basis.
Would the administration like to weigh in on Bill 81-20?
Happy to, Madam Chair. I did skip dinner, so this bill is troubling. No, I'm kidding. Pete Barron with the administration. Joining me at the virtual table is Ms. Say from Office of Planning and Zoning, and from Law, Ms. Kenny. The administration supports this bill. It's common sense to add it to the code. So happy to answer any technical questions the council may have, but we are supportive of the bill.
Are there any questions of my colleagues? Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. This is just for point of record. I did request to be a sponsor on this to our staff.
Okay.
Thank you.
Seeing no other questions or comments, we'll open the public hearing on Bill number 81-20. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair. First to Ms. Fiedler. Apologies if that was not reflected on the agenda, but it will be reflected, your co-sponsorship on the final bill.
Thank you, Madam.
Yes, Madam Chair, we have had, 13 submissions of written testimony on Bill 8120, which was shared with the council and posted on the county website.
Thank you. We will now hear from members of the public who signed up ahead of time. We have 2 people signed up to speak on this bill. Remarks will be limited to 2 minutes. When it's your turn, please unmute yourself and begin by stating your name and address for the record. Number 1 on my list is Mr. Thomas Giancola. Am I saying that right? Mr. Giancola, are you with us?
You stuck the landing perfectly.
Oh, great. Good evening, sir.
Good evening, and thank you, Council. My name is Tom Giancola, and I am a resident at 1910 Eleanor Court in Annapolis. I want to first just thank the Council and the administration for supporting this bill and for sponsoring it so quickly, and Ms. Rodvian for so quickly bringing this to the Council for consideration. Cottage food businesses are a great way to help support local businesses. We're active members of the community. You can find us at farmers markets, selling alongside local agriculture and local farmers. We provide a necessary gap for those who may not be able to get to the grocery stores, but still want to enjoy delicious, great baked goods from their homes or delicious jams. We're a small but growing group of people who are really excited to provide some value back to the community, and doing this out of our home truly has no adverse impact to anyone. We don't cause extra traffic. As Mr. Barron mentioned, we might fill the neighborhood, and Ms. Rodvian mentioned we might fill the neighborhood with some delicious freshly baked bread smells, but other than that, we are just entrepreneurs that are looking to supplement our incomes, provide some value back to our neighbors and community, and try and dip our toe in the water of making it run at a business. I thank the Council for their consideration of this, and I hope we can count on your support.
Thank you. Next on my list is Ms. Kimberly Haggard. Ms. Haggard, are you joining the meeting this evening?
I am here.
You have 2 minutes, ma'am.
Thank you.
State your name and address for the record.
Yes. My name is Kimberly Haggard, and I live at 1978 Valley Road in Annapolis. Good evening. I'm speaking tonight in favor of Bill 8120. I am a cottage food producer that makes artisan jams and jellies here in Annapolis. I complete most of my sales at the Anne Arundel County Farmers Market. I'm careful to follow the laws in place to the best of my understanding, and was surprised when I recently learned that while cottage food is legal in Maryland and Anne Arundel County, according to the Department of Health, which defines it as being produced in a home kitchen, zoning laws do not cover cottage food as a business that can be run out of a residence. My business does not create any additional significant traffic to and from my home, and driving by my house, you would never know that I run a business out of it. I've been making jams and jellies since I was a kid and really developed a passion for it when I moved to Annapolis in 2011. After teaching for 10 years, I made the decision to stay home when I had my son in 2015, and as he began to grow a bit older, I began looking for a way to contribute to the household income while still staying home with my son. Cottage food laws allowed me to do that. I was already making canned goods, and now I was able to make a little extra here and there to sell. In late 2018, I began selling at the Anne Arundel County Farmers Market. A lovely byproduct of this location is that I now get much of my produce for my jams and jellies from the Maryland farmers around me, as well as doing much of my weekly grocery shopping with them. I'm glad to be able to put money into the pockets of my local small farmers, while also allowing my customers a local option to purchase their jams and jellies, helping to keep more of their money in the state and county. I hope that the outcome of tonight's meeting helps to correct the apparent incongruency between government departments and officially adds cottage food businesses to the list of permissible home occupations according to the zoning code. Thank you all for your time.
Thank you. The public hearing on Bill number 81-20 is now closed. Madam Secretary, please read the title of Bill number 81-20.
Bill number 8120, an ordinance concerning zoning, home occupations, cottage food businesses.
Is there any further discussion? Seeing none, Madam Secretary, please call the roll on Bill number 81-20.
Ms. Hare?
Aye.
Ms. Lacey?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Bill number 8120 is passed.
Thank you. Madam Secretary, please read the title of Bill number 82-20.
Bill number 8220, an ordinance concerning zoning, requirements for special exception uses, indoor rifle, pistol, skeet, and archery ranges.
Thank you. This is Ms. Fiedler's bill. Ms. Fiedler, you have the floor.
Thank you, Madam Chair. Amanda Fiedler, District 5. This issue was brought to me by a constituent who owns a facility that trains individuals to have responsible and safe gun ownership. The indoor rifle, skeet, pistol, and archery range code right now is for C3 and C4 to be special exception with 400 feet to a residential area. We only have currently 2 indoor rifle, skeet, pistol, and archery ranges in the county. One is in open space in South County. The other is in northern Anne Arundel County and abuts a residential lot line. We actually have an outdoor range in the county in the 5th district. It is, again, it's outdoor, but it is very close to a residential lot line. And they actually had to get a variance for a net, but you can hear them, which is different from the indoor ranges. Indoor rifle, skeet, pistol, and archery ranges are really, when they are constructed, have mitigation for sound, which is a concern that we discussed during the work session, because folks go in there and they need to be able to discuss and chat with the employees. The staff needs to be able to talk and they need to be able to hear one another. So this bill would reduce the distance from one of these facilities in a residential area to 100 feet. It would still require public input through the special exception process, and would still continue to be allowed in C3, C4 only if approved through special exception. And I encourage my colleagues to support this legislation this evening.
Would the administration like to respond at this time?
I would be happy to, Madam Chair. Pete Barron with the administration. Joining me from OPZ is Ms. Say, and from Law, Ms. Kenny. I do want to thank the sponsor for addressing the concerns around public participation and keeping this as a special exception. The administration raised some concerns at the work session. We've had multiple discussions with the sponsor both before the work session and after. We appreciate all the work that's went into this. At this time, the administration has no opposition to this bill.
Are there any questions from my colleagues regarding Bill 82-20 at this time? Seeing none, we will now open the public hearing on Bill number 82-20. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we received 17 submissions of written testimony on Bill 8220, which was shared with the council and it was posted on the county website.
Thank you. We did not have any members of the public sign up to speak this evening. Therefore, now the public hearing on Bill number 82-20 is now closed. Madam Secretary, please read the title of Bill number 82-20.
Bill number 8220, an ordinance concerning zoning, requirements for special exception uses, indoor rifle, pistol, skeet, and archery ranges.
Is there any further discussion? Seeing none, Madam Secretary, please call the roll on Bill number 82-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Bill 8220 is passed.
Madam Secretary, please read the title of Bill number 83-20.
Bill number 8320, an emergency ordinance concerning proclamation of civil emergency in Anne Arundel County, termination.
Mr. Volke, you are the sponsor of this bill. You have the floor, sir.
Thank you, Madam Chair. Ms. Corby, if you don't mind, can you pull up that PowerPoint presentation? Thank you. Bill 8320 has created a lot of questions and a lot of misinformation. Next. But really, the bill poses one simple question. Who do you trust? Does the council trust Governor Hogan or County Executive Pittman to lead on reopening? Next. As we can see from a Goucher poll that came out last week, more Democrats and unaffiliated voters approve of Governor Hogan's COVID response than even Republicans. Next. Nearly 6 in 10 Marylanders agree with how Governor Hogan is reopening Maryland. 58% of Democrats, 61% of Republicans, and 55% of unaffiliated voters agree that reopening is happening about right. On top of that, 6% of Democrats, 32% of Republicans, and 20% of unaffiliated voters think reopening is happening too slowly. Next. The approval and the reopening speed numbers are even stronger when looking regionally. In the central region of the state, which includes Anne Arundel County and our peer counties of Carroll, Harford, and Howard County, 79% of voters approve of Governor Hogan's COVID response. 79% either believe that Governor Hogan is opening just right or too slowly. Only 18% believe that Governor Hogan is opening too quickly. Those numbers are staggering. In a world where polarization is off the charts, where almost 80% of our residents agree that we should be doing what Governor Hogan is doing, that's the statistics that we're facing. And I hope the county executive has seen these numbers. Next. Marylanders and Anne Arundel County residents are speaking. 433 citizens sent us testimony on Bill 83-20. 79% of them, 399 people, sent testimony in support of this bill. Take a look. The testimony is posted online. They're saying it's time to move to stage 3 and bring the council into the discussion on reopening decisions if the county is going to deviate from Governor Hogan's lead. Are we listening? Next. I know a lot of people are fearful of ending the local civil emergency because they believe, incorrectly, that all of a sudden we'll have no rules and be fully reopened. That's just plain wrong. If we end the civil emergency and pass Bill 8320, we will still have a mask ordinance, both by the governor's orders and the health officer's order for public safety. We will still have social distancing requirements under the governor's orders, and we will still have capacity limitations on businesses, restaurants, bars, churches, and social gatherings. Next. Here are the rules that we would be under in Anne Arundel County. If Bill 8320 passes, the governor will be leading the reopening, along with the Maryland Department of Health and the county health officer. Science and data will continue to lead our reopening. The only person who loses if Bill 8320 is passed is County Executive Pittman, because he will no longer be both the executive and the legislative branch in Anne Arundel County's government when it comes to limiting Governor Hogan's reopening decisions. If County Executive Pittman wants to limit Governor Hogan's orders, he'll have to come to the council and explain why. What is he afraid of? He's appeared in his town halls where no one can ask questions. He went to the school board to talk about reopening, but he doesn't come in front of the council and explain why he thinks being more restrictive than the governor makes sense. Why? Next. Because it would expose the fact that we are a clear outlier in the state of Maryland. There are 4 jurisdictions in the state that are not following Governor Hogan. Each of those is led by a liberal Democrat who wants to differentiate themselves from Governor Hogan. Why would they want that? Because they don't want to admit that Governor Hogan, a Republican, is leading well on COVID-19, even when data shows that Marylanders overwhelmingly support how Governor Hogan is handling COVID. As you can see, the only jurisdictions that are still not in phase 3 are Anne Arundel County, Baltimore City, Montgomery County, and Prince George's County. Next. The simplest answer to this question, why won't Anne Arundel County follow Governor Hogan's lead, is often the best. It's simply about power. It's about giving up power. County Executive Pittman has lots of new power. He and his staff do not want to be forced to deliberate these decisions in public. They do not want the council to have a vote. They do not want to risk that if something they don't like has to go into effect immediately because they want to limit Governor Hogan's orders, that they would have to get a Republican to support it. Because in our county, it takes 5 votes to pass something immediately. They got the Republicans once. They're worried they won't be able to produce the science and the data to back it up and get our support again. We provided that support in March when the science and the data backed it up. Next. At that point, we had an emergency. Emergencies require immediate action. COVID, 7 months into this local emergency, remains a significant challenge. But some things have changed. Next. Here's what we knew earlier this year when we initially voted on Bill 2420 to grant the county executive emergency powers. At that time, both Governor Hogan and President Trump had declared emergencies. We were told by the health officer that COVID had a 4% mortality rate, which was 10 to 40 times greater than the flu. We've learned that it's not nearly that high. At that time, we were told we had no treatment. That's changed. We were told the plan was to flatten the curve to prevent the overrun of hospitals. We were hearing that the guidance on how to handle COVID was changing hourly. And as the health officer told us, in his 20-year career, he'd never seen that. As he noted, guidelines typically take years to change. Hourly was unprecedented. We also heard that Governor Hogan was doing an impressive job responding to COVID. As the health officer said on March 16, 2020 in our meeting, quote, Governor Hogan's response has been impressive in responsiveness. We were fine to follow his lead. Marylanders continue to agree. Here's the question. If Governor Hogan was doing such an impressive job leading in March, what changed? Next. Governor Hogan's measured, science and data-driven approach has slowly and cautiously reopened Maryland. 3 months from the initial emergency until we moved to stage 1. 3 weeks until we moved to stage 2. Another 3 months until we moved to stage 3. Very deliberate, very cautious. But as he moved us along the roadmap, a number of ambitious politicians in large Democratic jurisdictions sensed an opening to disagree with Governor Hogan. By disagreeing, they could easily show that they, not Governor Hogan, truly understood how to lead on COVID. A compact was announced early on that the 8 largest jurisdictions in the state would move in concert on reopening. That crumbled quickly as a number of counties immediately went with Governor Hogan to stage 1. When Governor Hogan moved to stage 2, even fewer counties resisted. And by the time he moved to stage 3, only the 4 most liberal county executives and executives for Baltimore City, the mayor, resisted. Next. Which really comes to the purpose of the emergency powers. They are to handle situations where decisions have to be made in moments or hours. That was the case in March. It is not the case today. In March, Governor Hogan was holding press conferences almost daily. The CDC was changing guidelines and recommendations in days, sometimes hours. It was so uncertain that we were, by definition, in an emergency situation. Today, decisions are being made after weeks, not days or hours. If the situation arises again, where we need to make decisions that quickly, we can revisit the need for another civil emergency. But we cannot continue with a civil emergency in Anne Arundel County and make up our own rules just to give County Executive Pittman the chance to try and outlead Governor Hogan on COVID response. Next. To support that, at this point, there is no exigency or imminence to the decisions that are being made. They're being deliberated and decided behind closed doors. That's not how we pass laws or legislate in a democracy. Rule by decree in this country went out of vogue in 1776. History teaches us that too much power in the hands of one person is a bad thing. At any point, If the Maryland General Assembly disagrees with Governor Hogan, the Democrats in power have the votes to end his state of emergency. Why don't they do it? Because they agree with how he's leading on COVID. The only people who are not are the ambitious liberal executives in Anne Arundel County, Baltimore City, Montgomery County, and Prince George's County. And the only voices advising our county executive are those he's handpicked to be in the room. There are no minutes, there are no recordings, and that's just how the county executive wants it. Next. Because the purpose of the emergency powers was basically to issue executive orders. Here's a brief summary of how that purpose has changed. You can see Executive Order 16, EO, was issued on March 13th. From March 13th through April 14th, executive orders were used to help Anne Arundel County specifically. However, since Governor Hogan announced Stage 2 reopening, all these executive orders have only been used to deviate from Governor Hogan's plan. And when I refer to the executive orders, I'm referring to those that, if 8320, would go aside. There are other executive orders that the county executive has passed that the council could turn around and reinstitute in the event that we found it necessary. Basically, these executive orders have morphed from being a tool to keep Anne Arundel County safe in a turbulent time into a tool for county executive to again try to show he's leading better on COVID than Governor Hogan. And by making our own rules on reopening, the council has completely delegated our role as a legislative body to make the laws in our county. County Executive Pittman is now ruling by decree on reopening. Some may say we shouldn't get involved in these decisions. Well, I disagree. According to the latest Goucher poll, with 30% of Marylanders saying that COVID was the most important issue to them, and 22% saying the economy is the most important issue to them in this state, I can't see anything that our constituents find more important or want us to be involved in deliberating more right now than these reopening decisions, because these decisions are the intersection of COVID and the economy. This is our job. Let's do it. We were elected to make the hard decisions, not delegate these decisions to the county executive. Next. If we do this, we won't be alone. 6 Maryland counties never had a local emergency: Garrett, Allegheny, Frederick, Montgomery, Kent, and Caroline. Those are the counties shaded in the black here on this chart or this graphic you can see. 2 Maryland counties have allowed their local emergencies to expire: Queen Anne's and Talbot. Even if we don't have a local emergency order, we remain under the state emergency order. And that's all we need for federal funding and for grants. The auditor can confirm that ending the local emergency will not impact any current federal or grant funds. Next. The death toll, the infections, the positivity rates. As someone who has a close family member suffering from COVID in the hospital as we speak, these are all factors that have to be weighed in any reopening decision. But there are other costs too. Next. The Maryland Restaurant Association estimates that between 35 to 40% of all restaurants will close by the end of 2020. With those numbers, that means a loss of 450 restaurants and over 10,000 jobs in Anne Arundel County alone. These are real people. This is their livelihood, their property, their savings, their hopes, and their dreams, all gone. 2 high-profile businesses, Sunset Restaurant in Glen Burnie in District 2 and Union Jacks in Annapolis in District 6, both attributed a major reason for their closures to County Executive Pittman's restrictions in our county. Do you want to be responsible for killing thousands of jobs and putting these families out of work? Next. Our constituents are hurting, and instead of giving them an open forum where they can tell us how this impacts them, they're stuck with closed-door meetings and executive decrees. Businesses are not evil, amorphous entities. They are made up of people, and when we allow our businesses to suffer, we allow our people to suffer. Next. Beyond the economics, there are other health components to COVID-related shutdowns. As we heard the health officer talk about earlier, these issues are manifesting in mental health problems, as well as an increase in opioid addiction and further overdoses. And the issue is not just in adults, where we're seeing over 40% of people reporting at least one mental health or behavioral health condition, which is twice the number pre-COVID. It's in our students. It's being seen in the uptick in the opioid usage. It's a ticking time bomb, and it's a crisis that's looming. Next. The lack of leadership in our county is showing. Examples include the council saying, find a way to let businesses stay open past 10 p.m. The county executive immediately responded no. Days later, he flip-flopped and allowed them to stay open until 11 p.m. By the way, there was no data to say that restaurants had to close at 10, and there was no data to say that they could stay open till 11. Next, he came out and supported a hybrid reopening with in-person learning for schools. Then he heard from the teachers union, and the teachers union is a key special interest group for the county executive. He immediately flip-flopped his position and kowtowed to what they wanted. He said no to in-person learning at this time. He shut down youth sports. But then, the next day, after he was called out by the governor on how he did have the authority to allow youth sports, he flip-flopped and reopened them. Next. This issue has become political for the county executive and the council, but it's also personal. It seems the county executive may not particularly care for the governor. He did try to blame the governor for shutting down youth sports. The governor indicated how that wasn't true. The next day, the county executive changed that position. At this point, letting Governor Hogan lead would certainly be an admission that the county executive may not have had a better plan than the governor. He won't do that. It looks weak. The county executive at this point, and maybe even my colleagues on the council on the Democratic side, share a concern. If this emergency power goes away and any future deviations from Governor Hogan's orders have to be deliberated by the council, those of us in the minority may not go along. Democrats have the majority, right? Sure, but for anything to take effect immediately in Anne Arundel County, it takes 5 votes, as we'll see tonight. That means at least one GOP member has to join with the other Democratic members, if they were leading the charge on this, to deviate from any of Governor Hogan's orders. So to assuage those concerns, here's what I'll commit to tonight. If this bill passes and there's a deviation from Governor Hogan's orders that either the county executive or the council wants to enact, I'll give it a full and fair hearing. I'll review the data and the science behind the suggested legislation, and as I always do, I'll ensure however I vote will be for the best interest of all Anne Arundel County residents. Next. When I voted for Bill 2420 to extend the civil emergency in March, I agreed to it because we were tying the end of the civil emergency to Governor Hogan's leadership. He continues to do a good job. We should be following his lead. Instead, we've watched County Executive Pittman repeatedly flip-flop on reopening decisions. The health officer has admitted the rules were arbitrary all the way back in May. The county executive has admitted that the metrics were never really driving the decisions. Let's put Governor Hogan, someone who knows how to lead, back in charge. The citizens of Anne Arundel County are counting on us to let Governor Hogan lead. I ask for your support on Bill 8320 tonight. Thank you.
Thank you. Would the administration like to respond?
Thank you, Madam Chair. Chris Trumbauer with the County Exec's Office. Wow, so that was quite a presentation, and I'll commend the sponsor. I think obviously he put a lot of time and effort into it. The one thing I'll say about that before I get into my prepared remarks is I think the administration came to this public hearing to speak about public health, and it seems the sponsor would prefer to talk about politics. I almost think that presentation should have had an authority line at the end of it. I've not seen something like that before at a council presentation. And again, before I get into my prepared remarks on the bill before us, I do just want to correct some of the statements that were attributed to the administration in that presentation. First of all, the administration didn't cancel youth sports. What we did is we, according to the state guidelines, we did not allow tackle football to proceed because the state guidelines at the time recommended against that. That wasn't canceling youth sports. That was saying that competitive cheer and tackle football could not proceed as planned. They were modified to flag football and to, I think, no stunts in competitive cheer. And then the flip-flopping on the closing times, that was a specific suggestion that came out of the recovery work group to say, hey, we know that there's a last call at 10 o'clock and everyone has to get out. Would you consider keeping the restaurants open an additional hour, let people order their wine, their dessert, and then finish up in a reasonable time? We've seen some examples of restaurants having to close and people having to leave. And we took that into consideration. We talked to the health officer and we made that change. So the sponsor can call it a flip-flop. He can insult the county executive, he can insult the administration. It's okay, we've got thick skin, it's not gonna hurt our feelings, but I think the council deserves to know the actual facts. And then the last thing I'll point out, because the sponsor took a considerable amount of time extolling Governor Hogan and his response to the pandemic. The governor's executive order, each and every one, specifically provides local authority to local jurisdictions. So obviously the governor wants the locals to have the ability to make the right decisions for their own local jurisdictions in consultation with their health officers and health officials. That's quite clear in all of his executive orders. And Anne Arundel County and many of other jurisdictions have availed themselves of that condition in the governor's authority. So just wanted to point those out. Now, as to the matter at hand for Bill 8320, Governor Hogan declared a state emergency on March 5th. County Executive Pittman followed suit on March 13th. And County Executive Pittman believes today we're still in a public health emergency. There's three principal concerns that the administration has about 8320. The first is one reason that emergency powers reside with the executive branch during an emergency is that the county executive can move quickly and decisively when needed. The legislative branch can't act in the same way by design. Recently, the governor's executive orders, in fact, have been effective in some cases immediately, sometimes within 2 days. The council literally cannot act that quickly. So there would not be time if there was an instance where the governor enacted something that the local jurisdiction didn't agree with, there physically would not be time for the council to act to counteract that measure, which again goes, I believe, against the intent of the governor's executive orders. Secondly, the county executive receives constant information and insight from the health officer and other health officials. Dr. Kalyanaraman is an amazing public servant, but I can't imagine how he could possibly convey the same level of information and interaction to 7 individual council members within the open meetings laws. It's you guys would need and deserve and want a tremendous amount of information, and I think there's only one Dr. Kalyanaraman, and I think that would be an incredible burden for the health officer to try and inform 7 decision makers on that. And then the third and final point that I'll make is that County Executive Pittman strives to make the best public health decisions. He tries to be inclusive, accessible. There are 2 members of the council on his recovery work group, 1 representing each political party. We're open to insight, comments, and suggestions from all council members and from other county leaders. But wrestling away the emergency powers could move the deliberations away from public health and more towards political maneuvering. And to underscore that point, I refer you to the PowerPoint that we all just watched. So in closing, we understand that this is a disagreement about how and when to reopen the county during this pandemic. And we pledge to continue to be open and collaborative, but we ask you to please reject Bill 8320. Thank you, Madam Chair.
Are there any questions or comments from my colleagues for the sponsor or the administration? Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. For me, and I'm just going to respond a little bit to what Mr. Trimbar just said, for me, this is not actually about how and when to reopen the county and how fast. It's about transparency, and it's about having the public be part of the decision-making process. As the legislative body, we are the folks who represent the people in our districts. Each of us was elected for that particular purpose. And to have decisions being made behind closed doors where the public doesn't get the opportunity to provide input, it's not how it should be. We should be the ones who have that information. And I understand that may be hard and it may be inconvenient and it may require additional effort on everyone's part, but that's what we're here for. And so that is the purview of the legislative branch. The county executive you mentioned on the ability to act quickly. He doesn't lose the ability to act quickly. The code still allows him to issue 7-day emergency orders no matter what. He can always do that. And then within those 7 days, we can meet to decide whether to continue that emergency order or whether it expires. So I don't see that as having much credibility in terms of this. If Governor Hogan issues an order on a Monday that takes effect on a Wednesday, and you have to act quickly within those 48 hours, you can still do so. And then we have the time after that 7-day period or during that 7-day period to meet and confirm it. So for me, this is about giving my constituents the opportunity to use their voice, because right now they feel like they don't have a voice, and the businesses are hurting and employees can't earn a living and they don't have a voice in this conversation. And that's not right.
This is Allison Pickard, Chair D2. So I have a response to that, and I'll be brief. With that, should the governor, as the head of the executive branch of the state, also relinquish his executive power to the General Assembly? Is that what we're talking about during this once in a century global pandemic? Ms. Lacey.
Thank you, Madam Chair. Sarah Lacey, District 1. First, I have a couple of questions for Mr. Volke. Sir, who prepared that PowerPoint you presented?
I put it together by myself. Thank you.
Well, you do have excellent PowerPoint skills. How many slides did you show us?
I think it was 24 total.
And about how much time did you spend per slide?
I was up until 2 in the morning on Saturday, and I probably started working on it somewhere around 8:30 or 9. So you can do the math off of that, but I would think
9 in the morning or in the evening?
In the evening.
Well, you really do have excellent PowerPoint skills. Would you mind sending me the original version of your PowerPoint so I can check the file properties, please?
I don't know what that means, but
that's okay. I know what the file
in terms of file properties,
send it to me.
you
I'll be able
want
to
to check to make sure that I did it.
You shouldn't be
Okay.
speaking while I'm asking my question, sir. Would you please send me your original file? Would you send me your
I don't intend to do that.
Excuse me?
I said I don't intend to do that, but I have just said to you in a public forum, I created it myself entirely. So if you have a question about that, then I've given you my public statement. If you don't believe my word for it, then I suppose that's sort of where we're going to have to leave it.
Well, Mr. Volke, and this is again Sarah Lacey, District 1, the only way I could verify the answer to your question would be to look at the original data. And since you love original data, I expect you should really have no problem sending me that PowerPoint, especially because you couldn't be bothered to send it to your colleagues prior to the meeting. And I think I'll be putting in something to change the rules to stop you from doing that in the future. How inconsiderate and rude. I have other questions, but I'll save them for later and let other people speak.
Ms. Fiedler. You're muted. You're muted.
I'm still working on my technology. So I wanted to go back and reference some comments that were made about the work group. Since I am one of 2 council members that sit on the work group, I think it was important, or one of the slides that stuck out to me was the data on restaurants and bars, because that has been one of the areas that we have discussed significantly in the work group. And I will say that one of the suggestions during the work group or not really even a suggestion, but it was pointed out that the previous closing time of 10 p.m. really meant service stopped around 9:15, 9:30, probably at the latest, because restaurants were being visited by inspectors, and if they didn't have folks out by 10 o'clock on the dot, that they were being cited. It was suggested that if 10 o'clock was really the mark for ending alcohol service, that perhaps the restaurants and bars be permitted to stay open longer. But what was not, the important folks who were not in the room during that discussion were restaurant and bar owners. And I have asked repeatedly to have meetings with the county executive and restaurant and bar owners so that they could be part of the conversation. They know their industry better than anybody else. They could tell you if a good idea was actually a bad idea. And to date, there has not been a meeting scheduled. And this was a request made several weeks ago. I have also asked since probably mid-August what the plans are to guide our restaurants and bars for outdoor service. They have been trying to prepare, they have been begging, they've been asking, it's been brought up in multiple meetings, and they still to date have no idea what they are supposed to do to gain their tent permits. And the weather has officially turned. You can't eat outside until 10 o'clock at night when it's 60, 50, 45 degrees outside. Even if there are heating apparatuses, your food goes cold if you don't have walls. So I share the frustrations with my constituents, and I feel helpless to assist them. And that is my job as a legislator. So I share the frustrations of my colleagues, and I see this as bringing balance back. And I do believe we would be able to respond promptly. I think we would be able to meet in a more expedited process than some of the work group meetings are scheduled.
Madam Chair.
Mr. Trumbauer.
Thank you, Madam Chair. Chris Trumbauer with the County Exec's Office. I just wanted to respond to Councilwoman Fiedler's a couple comments that she made, and I wanted to take the opportunity again to thank her for being a member of the recovery work group and for continuing to advocate for her constituents. She does an excellent job and has been influential on that. But the two things you brought up, the first is the guidance on outdoor seating. So we have been working on that, Madam Councilwoman, and I just saw a draft of that come across today, and it looked pretty good. I think we're going to be releasing that tomorrow, as soon as tomorrow. So Greg Africa and his team and OPZ have been working very hard on that. So I just wanted to let you know that that should be coming out soon. Thank you for your advocacy on that. And you are in fact absolutely correct. You have been advocating for the county executive to meet with restaurant owners, and I can tell you that the Economic Development Corporation is pulling that together. It's going to be a little larger in scope than I think your original ask was, but we're going to pull together a kind of virtual town hall similar to when we did something with the pastors much earlier this year. We're going to do the same with restaurant owners. So thank you for being a persistent advocate for that. And I just wanted to let you know that that is moving forward. So thank you.
Ms. Rodbian.
Thank you, Madam Chair. Lisa Rodbian, District 6. Like my colleagues, I wish I had this PowerPoint ahead of time because I think there's some very creative use of statistics here. Comparing Anne Arundel County to some of the other counties that have been mentioned. For example, I believe Garrett County was one possibly in there, has had one fatality as a result of COVID since March. Anne Arundel County has now had, I believe, 251 as of today. To say that decisions are being made because county executives want to show that they can disagree with the governor is ridiculous. We have counties in central Maryland, such as Montgomery, Prince George's County, and Anne Arundel County, and I believe Howard County, have made decisions because they have very high case numbers. It has nothing to do with policy. It has everything to, or excuse me, with politics, and has everything to do with good policy in terms of keeping people safe from a deadly disease that we learned today an estimated possible 15% of people who have the disease, even if they do recover, may have lifelong symptoms. I personally, in my district, am aware of at least 8 children who have lost their parents to COVID. To talk about, to put that in the same gravity as whether or not your food gets cold is an insult to those children who have lost their parents, an insult to all of the family members who have lost loved ones. This illness is still raging in our communities. In fact, I looked at the data, and Councilman Volke, you should be very concerned about the increase in cases in your district. Annapolis and Glen Burnie had been hit very, very hard early. Annapolis is seeing a little bit of relief, very, very slight relief. I don't know that Glen Burnie is seeing that, but your district is starting to get hit hard. The reason that I feel comfortable leaving these decisions in the hands of Dr. Kalyana is that he is a doctor. He has an entire team. In fact, I think we learned tonight nearly 900 employees in the Department of Health, many of whom specialize in this very kind of question. And I don't want politics to become a part of what needs to be public health decisions. I really am tired of hearing about how this is some kind of battle between Stuart Pittman and the governor. I imagine that Stuart Pittman would love to have nothing, would love to be done with having to make all of these tough decisions that really can be life and death, and trying to work with people to accommodate different needs, different desires without sacrificing safety. You call it flip-flopping. I call it trying to work with people, trying to reach across differing viewpoints. I absolutely cannot support this. We're seeing our numbers going up again. Every public health expert with any credibility in the country is predicting that we are on the brink of a significant second wave as winter approaches. I don't want public health decisions to be driven by politics. They need to be driven by science and experts. And that's why I would like to leave this decision-making power in the hands of our county executive.
Ms. Fiedler.
There, I hit it. Thank you, Madam Chair. Amanda Fiedler, District 5. I wanted to circle back and comment again on Mr. Trumbauer's comments. I do appreciate that there is a meeting and larger in scope than I had originally requested that is in the works. I think that's a very good thing. But I think it also points out why this bill is important. Again, I started asking the question about meeting with restaurant owners weeks ago. I started talking about outdoor accommodation in August. We came back in September. We could have had, if 8320 had been passed, at an earlier time, we could have had emergency legislation to review the opening of restaurants and bars, and had Dr. K and the administration and restaurant owners and bar owners testify, and families like Councilwoman Ravian who have experienced firsthand, and we could do our job the way that it's meant to be done. And we would have been able to vote on it being emergency legislation before whenever this meeting is going to happen is actually going to happen. And it's really about timeliness and balancing it all. And that's where I am on this. So thank you, Mr. Trumbauer, for the update. I do appreciate that.
Ms. Lacey.
Thank you, Madam Chair. Sarah Lacey, District 1. I have a question for Mr. Swain. If you don't mind, sir, would you explain for us a bit the difference between the executive and the legislative powers as they relate to non-emergencies versus emergencies?
Well, Greg Swain, County Attorney. As far as relating to emergencies, what we're seeing and what we're talking about is the county executive's emergency powers. Emergency powers are always going to be extraordinary powers, and they're always limited in duration. Many of the things that have been done by executive order were done in response to some of the things that the governor has done in his executive orders. So, for instance, and again, as Mr. Trumbauer pointed out, the governor's been very clear that he has granted the local jurisdictions the authority to be stricter than his executive orders if it's in the interest of public safety. So, and I'll note that there are jurisdictions throughout the United States where the governors have not done that, and the local jurisdictions do not have the flexibility of weighing in and make their local restrictions more restrictive than statewide restrictions. So, you know, the difference between regular executive power and emergency executive power is exactly what we're experiencing. It's the power to do extraordinary things to deal with a pending emergency that are going to be limited in duration. Of course, COVID is extraordinary. We've had emergencies in the county before, typically snowstorms, hurricanes, things like that, where in a week or 2 weeks, the emergency is over. That's not what we're facing here. So it's an extraordinary event. It has required an extraordinary response. And the whole reason that we have those emergency powers is to give the county executive the ability to react quickly and to act on, in this situation, public health issues. So Dr. K is, as has been said, most of what the county executive has done, if not all of what the county executive has done lately, have been driven by the health metrics and have been based on the advice and discussion of those issues with Dr. K.
So just to follow up on that, Sarah Lacey, District 1, do you have an opinion as to whether the county executive's emergency orders are essentially actually legislative in nature? And could this body have as effectively rolled out legislation to accomplish the same ends?
Well, I mean, legislative in nature, I mean, they're not legislative in nature because they're all temporary measures. I would say that. Some things that the county executive has done, maybe many things he has done, could be done legislatively as well. But again, the whole thinking behind these types of emergency powers, both at the state and the local level, is the ability to react quickly and take actions that you wouldn't normally take, you would not take, but for the pending emergency. And all under that sort of umbrella of protecting, in this case, protecting public health.
Thank you.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Just to follow up on some comments that were made by Mr. Trumbauer and then touched on by Mr. Swain. We are on legislative day 29. Under our council rules and the charter, we're allowed to meet 45 legislative days per year. So we have 4 meetings that are still left for calendar year 2020. Mr. Swain, if I get anything wrong, please jump in and correct me, but I think so far I'm correct. That means that at the end of the year, assuming there are no additional special meetings, we will have used 33 of our legislative days, 29 plus 4, excuse me, leaving us a balance of 12 legislative days. That includes the fact that we had 2 special emergency meetings this year, one in May and one in March. So in a typical calendar year covering much of our legislative agenda, because we missed some meetings in there, we would probably wind up in about the same spot, somewhere between 10 and 12 legislative days left over at the end of the year. So if the concern of my colleagues or anyone in the administration is that the council lacks the ability to meet or act quickly enough, the days are there. We can have the meetings. We can come in on the special session. We can deliberate in a public setting, and we can vote to suspend our rules and immediately pass something. Mr. Swain, I don't want to put words in your mouth, but I went back and watched the meetings from March in preparation for tonight. And in those meetings, I believe that the discussion was, you all thought from the Office of Law that you could bring in Bill 2420 immediately, and we could have just had the hearing right then and there. But to try to be more transparent, we had, I think, a 3-day run-up, something like that, where it was advertised. If I'm getting the facts wrong on that, please jump in and correct me.
That sounds correct.
Okay. So my understanding is that if in the event we truly did have a situation where we thought the governor had done something which was going to be outrageously detrimental to Anne Arundel County, the county executive could immediately make the request to the chair, who has the authority under our rules, or to 3 members of this body who also have the authority under our rules to call for a special meeting. At that point, we could appear for a legislative day, we could suspend our rules, we could immediately, with 5 votes, do that suspension and then vote on an emergency ordinance, which would become effective immediately, and we would be able to put that into place. We can do all of that. Our rules allow it. We have that ability. So the idea of saying that we're going to be handicapped and somehow we won't be able to respond, it either is willful ignorance or it's a lack of understanding of how our rules operate and how they work. With respect to the idea that we can't get enough information from the health officer to make decisions, I understand the point that you can't get all 7 of us on the line and have a call because you're violating the Open Meetings Act. What you can do is have another, as I said, public meeting where you advertise and you say, we're going to be doing this legislative work. Mr. Swain, would such a meeting, if there was no legislation being proposed, count as a legislative day of the council? If we were simply to meet, the 7 of us, in a public forum and not consider legislation, but get an update on COVID-19 from the health officer?
Greg Swain, County Attorney. Well, yes, it would not be a legislative day. Let me also note that when we did the meeting on Bill 2420, there is, and I haven't looked at this in quite some time, but I can't recall if it's a advertising or a notice requirement for 5 days notice before you hold an emergency session, which is why we did it that way. I don't recall, and I'd have to review the discussion about having the meeting immediately. But we chose to there is a requirement that there be advance notice of the meeting.
Okay, and I believe that we could waive that requirement in the event that exigency dictated, but I'm happy for you to check that and correct me if I'm wrong. But again, going back to the point that we would be unable to receive constant briefings from the health officer, that's incorrect as well. We could meet, and without any legislation scheduled, it does not count as a legislative day. We would not be violating the Open Meetings Act, and we would have the full and complete ability to have a discussion with the health officer in public. He would still, as the doctor, be able to advise us as the expert on public health issues as to his expert opinion on public health. I would also clarify that we continue to be led at the state level. The governor is advised by some of the best physicians and experts in the world who we're blessed to have here in Maryland. But on top of that, we have a wonderful Maryland Department of Health that also advises him on these decisions. So the idea that we're going to move to phase 3, which he's already found to be appropriate in consultation with his health advisors and experts, I think, again, that's just either ignoring the facts or trying to distort them. I just want to clarify, at one point someone talked about taking away the executive power from the county executive. That's not what this does, and I think that's led to much of the confusion here. Emergency power. County executive retains all executive power that he's ever had under the charter, and if this bill passes, it doesn't impact that one bit. I just believe that this is something that we have heard from so many constituents on. I have here in my office, I sent these to all of you electronically earlier, but I have pages upon pages of petitions, let me show it correctly, that have been signed by individuals across the county, putting their names on these papers, saying that they believe it's time that we end the local emergency ordinance, that we revoke the emergency powers that have been granted to the county executive by this body, and that we step in and begin to offer a public forum and a way for our citizens to have their voices heard on these reopening decisions, particularly when they are going to deviate from what Governor Hogan is doing at the state level. Considering the aplomb that Governor Hogan continues to receive from Marylanders across the state, it's a little shocking to me that we are in a position where we think that we're going to do it better. And when he gave the authority to the local jurisdictions, I just want to be clear, he absolutely did do that. That is in his order. But the only reason that the local jurisdiction in Anne Arundel County is operating this way is because of Bill 2420. Had we not provided the emergency powers to County Executive Pittman, he would not be able to make these decisions unilaterally. My understanding is that he would need to come to the council with any proposed changes to the governor's orders or other measures that he thinks are necessary to protect Anne Arundel County citizens, and he would bring those to us and we would consider them. So while we certainly can continue to have local control, and revoking Bill 8320 doesn't get rid of that local control, we still have the ability as the council with the county executive in conjunction working together to protect our citizens, again, relying on our health officer, the state's health specialists and experts, and taking a look at the situation here on the ground. So I think that all of the arguments that are made against this, while they certainly sound compelling, when you unpack them a bit, it's pretty clear that none of them are actually real concerns. Again, I would ask my colleagues to consider this and to vote in favor of Bill 8320. Thank you.
Ms. Lacy.
Thank you, Madam Chair. I just have a few factual questions for my Republican colleagues, or just the two sponsors of the bill. Have any of you contacted your jurisdiction's state delegates or senators to ask them to reach out to the governor to have him remove local authority and control from his executive orders?
I'm happy to answer that first. Nathan Volke, District 3. I have not asked my state senator, or two state delegates, because we only have two where I live, to ask the governor to revoke the local control.
Ms. Lacy.
Ms. Fiedler or Ms. Hare, did you want to answer the question also?
I don't think that they're point of order, Madam Chair. I think I'm the only sponsor on the bill, so I'm happy to answer questions about my bill.
This is Sarah Lacy, District 1. If I misspoke about that, I'm sorry, Mr. Volke, but I still believe since all three of you, my Republican colleagues, have spoken in favor of the bill, it's proper to ask. Ms. Fiedler?
Thank you.
Point of order, Madam Chair. I think this is out of order.
It is.
Okay, well, you can argue that if you like.
Excuse me. We're going to keep order in this meeting this evening. Ms. Fiedler and Ms. Hare have the opportunity to not respond to a direct question. I think that's fair. You can choose not to respond, or you can choose to respond. Ms. Lacy, you have the floor.
Look, we don't need to be hiding the ball again, but the point is that in the, in Bill 2420, we all 7 of us agreed that we would terminate the county executive's emergency powers if the General Assembly either rescinded or terminated the governor's authority, or if the governor lifted his own order. So I think it's quite fair to ask whether you have asked your state representatives to advocate to the governor to accomplish what you're asking us to do tonight, which is to turn around and take away the unanimous decision that we had back in March, that was a reasonable way to end the emergency powers in the county. That's what I'm asking.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I agree. I don't think the question is an appropriate one in terms of personal conversations that people may have had with others. I will tell you, I've had this conversation with a number of people. I will not give out personal names because in the past when I've done that, it's not appropriate. But I will say that I have had this conversation with a number of people. I believe the emergency order that we did grant with Bill 2420 also has language to the effect of, or is otherwise terminated, meaning that this council can vote affirmatively to terminate it. So I think that each of those is looked at sort of independently. That's all I'll say for that. Thank you.
Ms. Fiedler, and then Mr. Pruski.
Thank you, Madam Chair. I will just answer with, I'm not going to answer the specific question because I don't think it's an appropriate question. I think it's out of order. But I will say I've had numerous conversations on many things at the state level, including the difference in metrics from the CDC to the state to the county, including guidance for restaurants and bars. I've had many conversations, and I couldn't really identify who has said what at this point. But that is all I'm willing to say at this juncture.
Mr. Pruski.
Madam Chair, there seems to be a lot of talking and dialogue, and some people believe it's important. But there's been the public that's been waiting, and a lot of talking heads going around. So I would hope that maybe we could open the public hearing again to allow folks to share, and if we can continue the conversation. Also, as a point of order, we have to pass this or vote on it by midnight, or it won't. And also, we had a resolution that we agreed to earlier where we suspend the rules. I'm not sure what debate will occur, but just as a matter of point of order, I don't know how long this is going to go, but I'll just leave it at that. Thank you, Madam Chair.
Thank you, Mr. Pruski. We are actually bumping up against our 90-minute need for a break for our transcriptionists, so this might be a good time to do that before we open the public hearing. So at this time, may I have a motion to recess until 10:55?
Councilman Pruski, so moved.
May I have a second?
Rod Van, second.
All in favor?
Aye.
Aye. Opposed? The motion carries. This council sits in recess until 10:55. Thank you. Good evening. Madam Chair, are you prepared to call the roll, please?
Yes, Madam Chair. Ms. Hare,
Present.
Ms. Lacy,
Present.
Mr. Volkey,
Present.
Mr. Pruski,
Here.
Ms. Fiedler,
Present.
Ms. Rodvian,
Present.
Ms. Pickard.
Present.
Madam Chair, all council are present.
Thank you. As we resume this debate, are my colleagues prepared to move to the public hearing at this time? Thank you. Madam Secretary, hold on 1 minute. We will now open the public hearing on bill number 83-20. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we have had 433 submissions of written testimony, which was shared with the council and posted on the council website.
Thank you. We will now hear from members of the public who signed up ahead of time. We have 13 people signed up to speak on this bill. Remarks will be limited to 2 minutes. When it is your turn, please unmute yourself and begin by stating your name and address for the record. And I will add that there is a timer and you will hear it at the 2-minute mark. And I ask that everyone respect that 2 minutes. The first person on my list is Miss Kathy Ridgely. Miss Ridgely, are you with us this evening?
I do not see her in the attendees list. She may have left the meeting.
Okay. Miss Helen White. Miss White, are you in the meeting at this time?
I also do not see Ms. White in the attendees list. She may also have left the meeting.
Okay, thank you. Third on my list is Miss Rosa Gargano. Miss Gargano, are you with us?
Hi, good evening. How are you?
Good evening, Miss Gargano. Please state your name and address for the record, and you have 2 minutes.
Rosa Gargano, 872 Burley Cove Road, and I also have a business in Lintica, Maryland. I decided to testify in favor of Councilman Nathan Volkey's bill on behalf of myself, family members who own business, friends who own businesses, and taxpayers of Anne Arundel County that opted to sit silent in fear of repercussions. We've abided by the lockdown, the mandates, the curfews, and the different stages. We believed in our elected officials who told us we just need to flatten the curve as we sat idle. Many of us losing our jobs and our businesses. Governor Hogan has moved us to stage 3, but the residents of Anne Arundel County are stuck idle in stage 2. We're being treated like adolescents that need 24-hour supervision, that aren't wise enough to make decisions on our own. We're being treated like we lack intelligence and aren't smart enough to run our businesses, return to work, or have personal lives. You're treating us like we lack common sense, and we need you to direct us in the right direction. Direction that is being led is killing our small businesses, some of which all of us have taken our life savings and put into fulfilling our dreams. The direction you're leading us in is causing business to cut hours and pay, leaving our employees struggling to make ends meet. I'm asking you to have faith in us, believe in us, trust us. I said, after all, we have had the intelligence to vote and elect you as our officials. And we're asking you to take all of your constituents' voices and listen to them. My speech has changed a little bit just due to some of the testimony I've heard. And I do have one question. It doesn't have to be answered, but I'm curious to know that have any of the council members reached out to their constituents to actually see if they're in favor of this bill? Because during the breaks, I went to different social media sites and I hadn't seen one person ask their constituents if they're in favor of this. And I feel like this is going to end up being a political battle against the councilmen for who sponsored a bill and who didn't sponsor a bill. And us constituents are going to be left suffering. That's all I really have to say. I want to just thank you for your time, and you guys have made me stay up very late this evening.
Thank you, Mr. Gargano. Next on my list is Mr. Jeff Tucker. Mr. Tucker, are you with us?
Yeah, I'm here. How are you guys tonight?
Great. You have, please state your name and address for the record, and you have 2 minutes.
Jeff Tucker, Bodkin Avenue, Pasadena. Support Mr. Volke's 8320. Overall, there's no way you're going to pass this. Let's be honest. This is about politics. And Mr. Volke speaking up for his people in Pasadena, which I greatly appreciate. Local resident, parent of twin boys, and local business owner of a small home services company, and am working on opening a bar in Pasadena, which has been a brutal process. I'm personally exhausted by Pittman's total control over Anne Arundel County residents, treating us like children. I feel like a kid that's been in timeout for months now. I think you guys should all stop the politics and you should listen to what we're saying, not only one side, but both sides. The hard fact is you guys all work for us. And, it feels like a dictatorship, to be honest with you. I think choosing to have Pittman decide what we do over the governor of our state is crazy. If it wasn't about politics, then you guys would let the governor decide what we do as opposed to Pittman. And I really do want to know, and I challenge anybody to provide the residents of Anne Arundel County with a resume justifying why Pittman should be deciding what we do as opposed to the governor of our state. While I don't actually have an open bar and I'm working on opening a bar, I'm not here because of the bar. I'm here because of the bar owners that I know throughout Pasadena. I know at least 10 bar owners in Pasadena. And the question that I'm constantly asked is, does COVID come out after 10:01? So I'm requesting that you guys provide us with some kind of proof to show us that COVID actually at 10:01 starts to become a real issue, because it sounds kind of ridiculous to me. I mean, I'm very passionate about people who've passed away and people that are sick, as I know many of them. But at the end of the day, the hard fact is that you're destroying a business. You gave the right to the business to open up till 10 o'clock. Now it's time to give us something. If it's not about politics, then you guys will give us something to do in the sense of helping a small business bar owner stay open till the regular time, even at a minimum capacity.
Mr. Tucker, I'm sorry, but your 2 minutes has ended and the buzzer has gone off.
I'm sorry. I'd like to thank Mr. Africa from the county department too, because he's been amazing with permits, and I think he's doing a great job. Thank you very much, guys.
Fantastic. Thank you, sir.
Well,
next on my list is Mr. Michael Murphy. Mr. Murphy, are you with us this evening?
Madam Chair, I do not see him in the list of attendees. He either did not join or may have left.
Thank you. Next on my list is Miss Michelle Sobolewski. I might not have gotten that one right tonight. Miss Sobolewski, are you with us?
Madam Chair, again, I do not see her on the attendees list, so she either did not join or may have left the meeting.
Okay, thank you. Next on my list is Miss Amy Britt. Miss Britt, are you with us this evening?
Again, Madam Chair, I do not see her on the attendees list, so she may have left the meeting.
Thank you. Next on my list is Mr. Adam Wyndham. Mr. Wyndham, are you with us this evening?
Oh, yes, ma'am.
Yeah. Mr. Wyndham, you have the floor. Please state your name and address for the record.
Adam Wyndham, 40 Carroll Road, Pasadena. President Obama's chief of staff, Rahm Emanuel, famously said in 2008, "You never want a serious crisis to go to waste. It provides the opportunity to do things that were not possible to do before. When this crisis started, flattening the curve and slowing the spread of the increased hospital capacity was more than reasonable. The COVID response has become more about political opportunism than legitimate safety concerns. We have seen this with groups pushing for hyper-political bills, which have little to do with education in order for us to reopen school buildings safely." Reference Congressman Anthony Brown's September 2nd virtual roundtable. In my response to my email on special education, a staffer from the county executive's office stated, "Unfortunately, Mr. Pittman doesn't have much say in how AECPS conducts its business." A few days later, another staffer responded with a more verbose email, basically saying the same thing, but with more pomp and circumstance. As we have seen recently, he does get involved when there's a politically beneficial public opportunity. During the August 26th Board of Education meeting, Dr. Kellyanne Rama continued to recommend school buildings stay closed, but after 5 months of closure, he still could not say on what basis he would recommend school buildings reopen. When pressed for specific metrics, he simply laughed. Reference timestamp 10228. The response to my advocacy for special education students over the last 3 months has unfortunately fallen on very partisan lines, which is disheartening since this is not a partisan issue. This was made abundantly clear when Mr. Pittman took time to respond to a group who organized a letter with over 1,100 signatures opposing the hybrid plan, but ignores a petition of over 4,000 signatures for special education students. I also did not support the hybrid plan as presented because it did not adequately address the needs of special education students. The group he responded to also supports getting those who need in-person instruction in the classroom 5 days a week, but as we saw during his recent virtual town hall, Mr. Pittman did not speak of those students. And finally, just tonight, Dr. Kellyanne Rama, when asked about no mask waivers for disabled students, he gave no clear answer and suggested it followed state guidelines. However, the CDC allows exceptions for disabled students, as does the governor's orders. The State Department of Education also recognizes students may be unable to use masks for medical or sensory reasons. I call on the council to vote for Bill 8320, revoking the county executive's emergency powers due to continued capricious and arbitrary decisions by the county executive. Thank you.
Thank you, Mr. Wyndham. Your 2 minutes are up. Next on my list is Ms. Karen Weiss. Ms. Weiss, have you joined the meeting?
Madam Chair, I do not see Ms. Weiss on the list of attendees.
Okay, thank you. We'll move along. Number 10 on my list is Mr. Curtis Kingsland. Mr. Kingsland, are you on the meeting with us?
Yes, I am. Good evening.
Good evening, sir. Please state your name and address for the record, and you have 2 minutes.
Thank you. It's been a long night. Curtis Kingsland, 1378 Becknell Avenue, Overton, Maryland, 21113. I already know what the other four majorities already said, but I believe the best is yet to come. And the bottom line is, from March till now, there's enough websites, there's enough people guessing stuff, but the bottom line is, I believe COVID's a virus is going to get who we want to get. And what we can do is what we did, probably because of 90-degree weather and everything else is gone, that the bottom line is, if there's such an increase in COVID, why is the hospitalizations and deaths gone down? You talk about the opiate crisis. Well, we know that people are dying, but COVID through CDC and other good websites show the hospitalizations and deaths has gone down. Of course, there's uptick because you're testing a ton of people, but the result is what? The hospitalization and deaths has gone down. As a small disabled veteran, small owner, I'm handcuffed and I'm worried about the taxes. And I sum up the county and the state of Maryland. The lives and livelihood of all Maryland County residents has been sacrificed, at least temporary and maybe permanently, by a harsh tyrannical restriction forced on by a team of government physicians, most of whom had never practiced medicine in a clinical office setting. Like so many government bureaucrats, they prophesied of death and disease are derived from flawed computer models based on inaccurate data that are guaranteed to predict the most extremely adverse outcome. It's not about cases, it's about hospitalization and deaths. The majority, we already know what the deal is, but I hate to say it, but the numbers don't match and the hospitalization and deaths aren't. So do the right thing, please. Thank you.
Sorry. Thank you, Mr. Kingsland. Next on my list is Ms. Nalda Fink. Ms. Fink, are you on the meeting with us?
Yes, I am. Good evening.
Good evening. Please state your name and address for the record, and you have 2 minutes.
My name is Nelda Fink, 8372 Norwood Drive, Millersville. I'm in District 2 with you, Ms. Pickard. Council members, first, I want to thank you for giving us this opportunity to provide testimony today, and thank you very much, Councilman Volke, for bringing this bill forward and recognizing the new data and that the situation has changed since March. There's a song, and perhaps you know, and perhaps you know it. It goes like this. I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. Today I don't see the trees of green, the skies of blue, or the red roses, or any blooms. I see whole strip malls closed and for sale. I see struggling businesses with barely enough revenue to cover their costs to be open. I see people being rejected from stores because they can't wear a mask. Store owners turning down the revenue needed to exist. I see separations of neighbors, of families and children and the elderly. I see schools empty and children being forced to learn through a numb and single dimensional screen. I see people being evicted with no place to go in this wonderful world we call Anne Arundel County. I see this. You are a human being and you occupy the same space on this wonderful world that I do. And yet you don't see this? Where is the compassion that I know exists within each and every one of you? We need a course correction and we need it now. There's absolutely no justification for continuing to hold the people in this wonderful world we call Anne Arundel County hostage in the phase 2's restrictions. The CDC recently posted new, more accurately counted COVID-19 metrics, which shows the virus was not nearly as deadly or dangerous as was expected. From my perspective, this would be a green light to all the elected officials that, hey, we can now fully open and the virus wasn't as bad as predicted and that we all survived. Hoorah. Yet this is not the action taken. No, instead we get more restrictions, more separation, and more continued oppression and destruction of our wonderful world we call Anne Arundel County.
Ms.
I
Fink,
don't stop celebrating and opening fully instead. Even Scott Atlas recently stated anyone who's talking about another lockdown has really not been paying attention for the last 7 months.
Ms. Fink, excuse me, I'm sorry, but the buzzer has gone off and your 2 minutes are up. It's
I just finished my last sentence.
Sure, go ahead.
Okay. It's time our elected officials course correct away from the oppressive party narratives and false party loyalties and start allowing the human compassion that I know exists in each and every one of you and support this bill. And then you'll be supporting the neighbors of whom you were elected to serve. Thank you very much.
Thank you. Number 12 on my list is Mr. Brooks Schandelmeyer. Mr. Schandelmeyer, have you joined the meeting?
Yes, Madam Chairman. Madam Chair, I apologize.
May you state your name and address for the record, and you have 2 minutes.
Thank you, Madam Chair. My name is Alderman Brooks Schandelmeyer on Stone Creek Road in Annapolis, Maryland. I am here to oppose Bill 8320. Anne Arundel County has performed very well during this pandemic because of the leadership of County Executive Pittman and Dr. K. Reckless reopening for political gain will reverse that. We've seen that in other jurisdictions that have done this. As elected officials, we have an obligation and a duty to perform what's best for the health of our constituents, not to score political points just to climb the ladder. As Councilman Volke's presentation showed, this is pure interest. I have not seen anyone talk about liberal county executives in any county council meeting I have seen in my many years in this county, man. But Annapolis's 5th Ward is very diverse. We have a large Latino and African-American community, and these populations face a disproportionate impact of the COVID pandemic. Reopening irresponsibly will put them at risk, and people will die. I know they aren't your donors. I know they aren't the people that go to your cocktail parties at the yacht club, but they are still people. They are my constituents, and their lives are on the line because of this. So I'm going to ask you guys to oppose Bill 8320. Thank you.
Thank you. Number 13 on my list is Mr. John Contour. Mr. Contour, I'm not sure I'm saying your name right, but are you with us this evening, Mr. Contour?
Yep, sorry, I was muted there. Good evening, everyone. John Contour, Spaview Avenue, Annapolis, Maryland. For background, I'm a physician, internal medicine doc, practiced for over 15 years, executive at a large health system, and now I'm a senior executive at one of the largest healthcare companies in the US. And I think a lot of what needs to be said for you guys to make a good decision on this tonight has been said already. So I'll quickly get to just 2 points that are incontrovertible. One is that COVID is not continuing to get better. We had a peak in cases early in the pandemic. Numbers started to get better. They stabilized. And now in most regions in the US, and there's evidence here in Maryland and even our own county, there's really evidence that the numbers are starting to get worse, not continuing to get better. And more importantly, for this decision, COVID's a local disease. So the experience in each state is different. Experience in each county in our state is different also. So this is not a question of do we trust Hogan or Pittman to make these decisions. The question is, should a single policy dictate what we should be doing everywhere in the state, or should our professionals and leaders in Anne Arundel County be making decisions for the county? So in summary, as a lifetime healthcare professional, I advise the council that this is not the time to soften our defenses. It may help economically transiently. That's going to backfire in the months and weeks and months to follow. And as an Anne Arundel County resident, I urge you to leave the management of this disease in the hands of the leaders and the professionals of this county.
Thank you, sir. Madam Secretary, I don't know if you can see the list. Have we had anybody?
Yes, we actually have, I think we have to go to Francis Burton, and then I see that Ms. Sobolewski has joined the meeting.
Oh, okay. Is Ms. Francis Burton with us this evening? Ms. Burton? Oh, here she is.
I'm here.
Ms. Burton, good evening. Please state your name and address for the record, and you have 2 minutes. Ms. Burton, we lost you again. Are you with us?
Ms. Burton, you are, there she is.
Can you hear me now? Sorry.
Yes, ma'am. Yes, ma'am. No problem. We've all been
My
there.
name is Francis Burton, 4403 Sharon Drive. I signed up, but not for this section. I have something totally different. I'm sure Mr. Volke knows what I'm referring to. So I don't know if I should speak during this or not. It has nothing to do with this.
No, this is the public hearing for Bill 8320. Mr. Volke, did you have something to add?
Yeah.
I was only going to clarify, Madam Chair. I think Ms. Burton intended to testify during the invitation to audience about a development issue that we have that's pending in Pasadena. Ms. Burton, am I getting that correctly?
That is correct.
Okay. So I don't think her testimony relates to 8320, but I don't know if there's a way that we can allow her at some point, given that she's waited for 5 hours and 20 minutes to talk, the opportunity to at least have her say at some point in the meeting.
That's difficult to address, Mr. Volke. Maybe Madam Parliamentary can help, but the agenda's set. We've passed and closed invitation to audience. This is for testimony on Bill 83. I don't see an avenue at this point for this meeting. You know, she can come to invitation to audience at the next meeting, or she can send in information to the council. I'm not sure. I'm just.
We need to proceed with the public hearing for 8320 at this time. Can we defer this conversation to once we get through this bill? Okay. My apologies, Ms. Burton. And it's my understanding Ms. Sobolewski has joined the meeting. Ms. Sobolewski, are you here? And it's my understanding Ms. Sobolewski has joined the meeting. Ms. Sobolewski, are you here?
I am.
And it's my understanding
Ms. Sobolewski, you need to turn off any, or mute if you have this on TV or another device.
Okay, can you hear me now?
Yes, thank you.
Please state your name and address for the record, and you have 2 minutes.
Okay, hi, I'm Michelle Sobolewski. I live in Severn, Maryland.
I am a mother of 3 teenagers. They're watching it, so I'm going to walk away from the TV. And healthcare professional and very active in Anne Arundel County Public Schools as far as volunteering and such forth. Thank you, first of all, for listening to me, and thank you, Nathan Volke, for all you do for Anne Arundel County. That said, I'm real upset by what's happening tonight, and my entire speech has been completely changed. I also actually live in Sarah Lacey's district, and her attack on Volke was just unprofessional. It is blowing up social media right now. I will tell you, Lacey, you do not speak for your district at all. Anne Arundel County is done with this. The metrics do not match to keep us closed. We should be open well and far into phase 3 or wherever Governor Hogan has us. Businesses are dying. Teenagers are depressed, suicide, depression. It's off the hook, and I can speak because I have teenagers. You've taken their sports away. You've taken everything away that Anne Arundel County residents, and I'm a lifetime resident of Anne Arundel County, has worked hard for. There is no reason to keep us under lock. And my daughters all work in restaurants, and the way the restaurants are going is ridiculous. If you can walk in with your mask on, once you sit down, you can take your mask off. Now you're safe from COVID. After 10 p.m., COVID comes out. I mean, every rule is just more ridiculous than the next. And my 2 minutes weren't to argue by any means. But Nathan Volke is trying to help us. Jessica Harris, thank you as well. But this has to end. I mean, again, I'm in healthcare. These things aren't going away. We have the flu every year. We have SARS. We have H1N1. I know people with COVID. I'm not downscaling it, but people that live have to live. We have to go to work. Our kids have to go to school. Life has to go on. It has to. It's just the way it is. So hopefully you guys make the right decision. I vote 100%, as does the vast majority of Anne Arundel County, to vote for 8320. Thank you again, Nathan Volke, and we need to move forward.
Thank you, Ms. Sobolewski. Your 2 minutes are up. Thank you for joining us. Madam Secretary, before I close the public hearing, can you just double check that people haven't popped in?
Let me take a quick look.
We were missing a couple that had signed in. Miss Ridgely, Miss White.
Yeah, I do not see them on the list. No, it looks like they have not joined.
Okay, thank you. At this time, the public hearing on bill number 8320 is now closed. Madam Secretary, please read the title of bill number 83-20.
Bill number 8320, Proclamation of Civil Emergency in Anne Arundel County, termination.
Is there any further discussion from my colleagues at this time? With that, as chair, Allison Pickard, chair D2, I will just add a couple points before we call the roll. There's a couple concerns I have about the presentation from the sponsor. One of them mainly is that there were absolutely no public health metrics. And if we look back to where our public health metrics were lowest since we were engaged in this, they were in June when we were in tighter restrictions, and they just keep going up from there. I'm a little concerned that no public health metrics were mentioned in the presentation, and it was completely political. And that concerns me as we move forward. It's my understanding from public health experts that the next 6 to 12 weeks could be the darkest the United States sees in this pandemic. And while I believe wholeheartedly that our work with our CARES Act dollars and any new stimulus from the federal government needs to address very targeted response in an economic fashion, we cannot ignore the public health situation in our midst. The federal government has epically failed the United States in our response, and I will not be a party to a continuation of that failure at the local level. We are the last line of defense in this once in a century, and I will not be voting for 8320 at this time. So with that, Madam Secretary, please call the roll on bill number 83-20.
Ms. Hare,
Aye.
Ms. Lacy,
Nay.
Mr. Volkey,
Aye.
Mr. Pruski,
Nay.
Ms. Fiedler,
Aye.
Ms. Rodvian,
On behalf of the 251 Anne Arundel County residents who've lost their lives to COVID, the nearly 2,000 people in District 6 who have become sick from COVID, and the 51 people who are fighting for their lives in our local hospitals, I vote no.
Ms. Pickard,
Nay.
3 in the affirmative, 4 in the negative. Bill 8320 is defeated.
Madam Secretary, please read the title of Resolution 42-20.
Resolution 4220, resolution recognizing Sunday, November 1st, 2020 as Maryland Emancipation Day in Anne Arundel County.
This is Ms. Rodvian's resolution. Ms. Rodvian, you have the floor.
Thank you, Madam Chair. I think I need to take a breath after rather heavy conversation. But this is actually starts with a heavy conversation and ends with a little bit of reason for celebration. So I know I'm at risk now of becoming the councilwoman who tries to bring different days of recognition into our awareness. But the fact that 2 were quite close together was not enough a reason to stop me. So I think just for simplicity, it's already well written. I would just like to read the resolution into the record. This resolution will recognize Sunday, November 1st, 2020 as Maryland Emancipation Day in Anne Arundel County. Whereas President Abraham Lincoln's Emancipation Proclamation of 1863 freed slaves in Confederate states, but not in the Union state of Maryland. And whereas Maryland's Constitution at that time forbade the passage of any law that would abolish slavery, and to end slavery, Maryland needed a new constitution. And whereas in his annual message to the Maryland General Assembly in 1864, Governor Augustus W. Bradford asked for a constitutional convention bill to address the issue of slavery in Maryland, and the legislature promptly complied. And whereas delegates to the Constitutional Convention of 1864 were elected by the voters on April 6, 1864, and the convention convened in Annapolis on April 27, 1864, and adjourned on September 6, 1864. And whereas William Bond Sprigg Harwood, Dr. Eli Henkel, and Oliver Miller were delegates from Anne Arundel County, and whereas a statewide referendum was held on October 12th and October 13th, 1864, with special provisions to allow soldiers in the field to vote, and the new state constitution was adopted, whereas the Maryland Constitution of 1864 went into effect November 1st, the same year, and the enslaved people of Maryland were finally declared free. And whereas slavery in other parts of the United States was not officially ended until June 19th, 1865, also known as Juneteenth, more than 7 months after Maryland abolished slavery within its borders. And whereas the 13th Amendment to the United States Constitution that finally abolished slavery nationwide was not ratified until December 6th, 1865, more than 1 year after enslaved people of Maryland were freed. And whereas Maryland and all of its counties played an important role in the end to the slavery in the United States, now therefore be it resolved by the County Council of Anne Arundel County, Maryland, that it hereby recognizes Sunday, November 1st, 2020 as Maryland Emancipation Day in Anne Arundel County, and calls upon the people of Anne Arundel County to join their fellow citizens in recognizing this special observance. And I will leave it right there. There is a movement to make this recognition statewide, and it has been done so at some in some capacity. And I hope you will support this resolution recognizing this important day in Maryland history this evening.
Thank you, Ms. Rodvian. Would the administration like to weigh in on this resolution at this time?
Thank you, Madam Chair. Pete Barron with the administration. The councilwoman said it very well. It's a powerful resolution, and while you may have done a couple of recognition resolutions, these matter. This is an important part of our history, and the administration strongly supports this resolution.
Are there any questions from my colleagues for the sponsor or the administration at this time? Seeing none. Madam Secretary, please call the roll on resolution number 42-20.
Ms. Hare?
Aye.
Ms. Lacy?
Aye.
Mr. Volkey?
Aye.
Mr. Pruski?
Aye.
Ms. Fiedler?
Aye.
Ms. Rodvian?
Aye.
Ms. Pickard?
Aye.
7 in the affirmative, none in the negative. Resolution 4220 is adopted.
Madam Secretary, can I just ask, I know Ms. Frances Burton was on the call on the meeting to speak at invitation to audience. Is it my understanding that she was not here during invitation to audience, or how did we miss that?
She was not here.
Okay.
Or no.
I mean,
well, she wasn't here, and I believe.
I mean, she was on my list, so I just. It was.
I did not. I don't believe she was here.
Okay.
On the in the meeting.
In the meeting at the time we had invitation to audience. Is that my understanding?
That is correct.
Okay.
That is correct. She wasn't here when we had invitation to audience.
Okay.
I believe she may have joined after that, but we had already closed invitation to audience and moved on to other things.
Okay. Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. I would like to make a motion to suspend the rules and allow Ms. Burton to testify now in light of the unusual circumstance of her waiting for, I think, 5+ hours for the opportunity.
Unfortunately.
I'll second that motion.
Unfortunately, Ms. Burton, it appears that if she is not here.
Oh, okay. Well, I do believe we each received, or at least I received emailed or online testimony, so we can reach out and maybe she'll want to join us at November 2nd. I feel bad. With that, is there any other business to be brought before the County Council at this time? May I have a motion to adjourn?
I believe Mr. Persky would like to motion. Sorry.
May I have a second?
Fair second.
All in favor? Aye.
Aye. Aye.
Opposed? The motion carries. The County Council is adjourned until 6 p.m. on November 2nd, 2020.